Audio is fine, doctor. Oh, okay. Namaste and good evening to Dr. Anand P Ambali, resource person of this evening, Mr. Shivam and his team of NIMHANS, team from NIMHANS, who are providing online and offline support for conducting the webinar. Dr. Professor P.T. Sivakumar, head of the Geriatric Psychiatry Unit of NIMHANS, and Dr. Vijay Kumar Hebishettar and his team of doctors who are responsible for these webinars. A number of doctors who have joined for participating in this meeting, the enthusiastic and inquisitive viewers and participants of this webinar from across the country. I welcome all to this webinar being organized by Vayomanasa Sanjeevani, an arm of Geriatrics Unit of NIMHANS, Bangalore. It is my pleasure to introduce Dr. Anand P Ambali, a distinguished, highly qualified practicing geriatrician. He is now the Dean, Professor and HOD of Geriatrics Department at Sri B.M. Patil Medical College Hospital and Research Center, Vijayapura, Bijapur. As regards his academic achievements, he finished his MBBS degree in the year 1996 and MD in General Medicine in the year 2002 from B.M. Patel Medical College Hospital and Research Center, Vijayapura, and PGDGM at Ramaya Medical College in 2006. He did also certificate course in palliative care in 2011 at St. John's Medical Health Center. Later, he moved over abroad and he did MSc in Dementia at the University of Stirling, Scotland, sponsored by Commonwealth in the year 2018, and became a fellow of the Royal College of Physicians, FRCP, in the year 2022 at Edinburgh, UK. It is a postgraduate qualification that recognizes a doctor's contribution to medicine and provides professional recognition to doctors. Doctors with FRCP are eligible to work as physicians in the UK. Dr. Anand is occupying important positions in several national and international organizations. Some of them are: he is Vice President of Geriatric Society of India from 2000 for the period 2021 to 25. He is a EC member of Association of Physicians of India, Karnataka chapter 2022 to 25. He is a master trainer in National Program Healthcare for Elderly. He is a Commonwealth Scholar for MNC in Dementia at Scotland. He is Dean Student Affairs at Blade Deemed University from the year 2018 to 2025. And he is Adjunct Faculty Medical Education, Blade Deemed University. Faculty for TAPAS, online program by Government of India. A number of organizations have appreciated Dr. Anand's work by giving him awards. He is also recipient of Vayomanasa Sanjeevani Award from Government of Karnataka in the year 2016. He has several publications to his credit. Dr. Anand has started a full-fledged geriatric clinic in the year 2014 at Vijayapura. He has more than 3,000 seniors as his patients. He specializes in the comprehensive care of older adults, focusing on their unique health needs by promoting wellness and through emphasizing on preventive health care. Despite his tall achievements, Dr. Anand is a humble, easily approachable gentleman. He has been attending our VMS programs and used to share his knowledge on many matters. The topic of this evening is falls in older people and prevention. Is very relevant to us as falls are recognized as a highly probable event in a senior's life. And on many occasions, consequences of such falls are serious. We are today fortunate to hear from such an accomplished specialist on ways to live our life without any falls. I thank Dr. Anand for sparing his valuable time and using his knowledge and experience to educate us on this important matter. Dr. Anand Saab, as you know, we are a set of mostly seniors interested in maintaining good health for ourselves as well as for our near and dear. With that objective, we listen to experts like you and implement your suggestions. We also share them with our friends and relatives. Therefore, we shall listen to you very carefully. As a meeting hygiene, I request all listeners to mute their mic in case of any doubt. They can send a message through chat for speaker to respond to them at the end of the presentation, if time permits. You can unmute and raise your doubts at that time also. Yes, Dr. Anand, the floor is now open to you. Please go ahead with your presentation. Thank you.
Thank you so much, sir, for this kind words. And I think my screen is seen. Yes, sir. Am I visible with my screen, sir?
Yes, doctor. Everything is pakka.
Yes, sir. So thank you so much for having me here, and thanks to you also, because you were behind me for a long time, and somehow you caught me early. So I have been involved with Vayomanasa Sanjeevani also, and thanks to the institute and Dr. Vijay Kumar sir and Dr. of course Sri Jambunathan and the team and all the senior citizens here. A very good afternoon to all of you. Ellarige namaskaraಗಳು ಇಂದಿನ ಸೋಮವಾರದ ಸಂಜೆಗೆ. Today we will be discussing about falls and prevention. ಬೀಳುವಿಕೆ ಹಿರಿಯ ನಾಗರಿಕರಲ್ಲಿ ಬೀಳುವಿಕೆ ಬಹಳ ಮಹತ್ವದ್ದು. ತಾವೆಲ್ಲರೂ ತಮ್ಮ ಯಾರೇ ನಿಮ್ಮ ಸಹೋದರ ಆಗ್ಲಿ ಅಥವಾ ನಿಮ್ಮ ಸ್ನೇಹಿತರಾಗ್ಲಿ ಯಾರಾದರೂ ಬಿದ್ದಿದ್ದು ನೀವು ಕಂಡಿದ್ದೀರಿ. ಬಿದ್ದ ನಂತರ ಅವ್ರಿಗೆಲ್ಲ ಏನೆಲ್ಲ ತೊಂದರೆ ಆಗಿದೆ ನೋಡಿದಿರಿ. ಇದೆಲ್ಲ ನೀವು ಸ್ವತಃ ಅನುಭವಿಸಬೇಕಂತೇನಿಲ್ಲ. ಯು ಡಿ ನಾಟ್ ಹ್ಯಾವ್ ಎನ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಆಫ್ ಫಾಲ್, ಬಟ್ ಯು ಹ್ಯಾವ್ ಸೀನ್ your friends, your colleagues who had fall, and some were lucky to come back with you for the morning walk. Some are unlucky who are bedridden with a fractured neck and inoperable. So anything can happen with the fall. So how to prevent a fall is more important. Once a fall occurs, then managing it, that is a different issue. But as Sri Jambunathan sir told, yes, we have to prevent. Geriatric medicine is the place where we do a lot of preventive work. In our own clinic, as sir told, though in 2007 we started the third clinic in Karnataka, then after Bangalore, in whole of the Karnataka, Bijapur was the first in North Karnataka to start a geriatric clinic in 2007. We also have a dementia clinic. We also have an immunization clinic, Chuchumuddu Kendra. Hiriya Nagarikarigagiye idda Chuchumuddu Kendra, one of its kind. And we do a lot of preventive services for the older people in our clinic. In that falls. Now, in next 40 minutes, what sir has given to me, so that we can discuss some other things also. And I also welcome my other doctor colleagues and all the senior citizens again for this program. We'll study some case scenarios and what falls leads to. ಬೀಳೋದ್ರಿಂದ ಏನಾಗುತ್ತೆ, ಆಮೇಲೆ ನಾವು ಎಲ್ಲರೂ ಏಕೆ ಬೀಳ್ತೀವಿ, ಆಮೇಲೆ how to prevent. So as sir told, ultimately in geriatric practice, our main aim is to improve the quality of life. No matter how many problems the older person is having, we have to improve quality of life, bring back to the near independent lifestyle that they were having. So with that background, what we want to try to impress, as sir was asking, fall is not just due to one reason. If the patient is having the fall, he has got multiple causes. It is not the one cause that immediately leads to fall. There are multiple causes, there are multiple risk factors, and you need a team approach. Only one person cannot handle a patient, older person with the fall. So the scenario of fall is very complex. ನಾವು ಬರೀ ಹೇಳ್ತೀವಿ ಅಜ್ಜಾರ್ ಬಿದ್ರು, ಹೌದು, ಮುಂದೆ ಏನಾಯ್ತು, ಯಾಕೆ ಬಿದ್ರು, ಇನ್ನೊಮ್ಮೆ ಬೀಳಬಾರ್ದು. ಎಷ್ಟೋ ಜನರು ಬೀಳ್ತಾರೆ, ಸಕ್ಸಸ್ಫುಲ್ ಆಪರೇಷನ್ ಆಗುತ್ತೆ, ಮನೆಗೆ ಹೋಗ್ತಾರೆ, ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಆಗುತ್ತೆ, ವಾಕರ್ ತಗೊಂಡು ನಡೀತಾ ಇದ್ದಾರೆ, ಮತ್ತೆ ಬೀಳ್ತಾರೆ. And that is the time when we lose him from the social activities. So fall is not a single entity, to a single entity. It has got multiple causes in a single person, and there are multiple risk factors, and that's why we need a team approach. So you need a surgeon, you need a physiotherapist, you need a geriatrician, you need a physician, or occupational therapist, social counselor, psychologist. So many people need to come in the team for to help the person get back to the normal life. So why we talk about fall? As sir was telling, why it is important, because they are the major cause of morbidity in elderly population. ಹೆಚ್ಚಿನ ಜನರಲ್ಲಿ ಬೀಳುವಿಕೆ ಆದಲ್ಲಿ ಅವರು ತುಂಬಾ ಜನರು ಹಾಸಿಗೆ ಮೇಲೆ ಬೀಳುತ್ತಾರೆ, ಇಟ್ ಲೀಡ್ಸ್ ಟು ಮಾರ್ಬಿಡಿಟಿ. ಅಥವಾ ಅವರಿಗೆ ಒಂದು ಭಯ, ನಾನು ಮತ್ತೆ ಬೀಳ್ತೀನಿ, ಫಿಯರ್ ಆಫ್ ಫಾಲ್, ದಟ್ ಇಸ್ ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಮತ್ತೆ ಬೀಳ್ಬಾರ್ದು, ಮತ್ತೆ ನಾನು ಬೀಳ್ಬಾರ್ದು ಅಂತೇಳಿ ಬೆಳಿಗ್ಗೆ ವಾಕಿಂಗ್ ಹೋಗೋದು ಬಂದ್ ಮಾಡ್ತಾರೆ. ದಟ್ ಈಸ್ ಅಗೇನ್ ದ ನೆಗೆಟಿವ್ ಇಂಪ್ಯಾಕ್ಟ್ ಆನ್ ದ ಫ್ಯಾಮಿಲಿ ಅಂಡ್ ಹಿಮ್. ಅಂಡ್ ಆಸ್ ಐ ಟೋಲ್ಡ್ ಯು, ನಾಟ್ ಆಲ್ ಹೂ ಫಾಲ್ ವಿಲ್ ಡೆವಲಪ್ ಇಂಜುರೀಸ್. ಕೇವಲ 10% 25% ಜನರಲ್ಲಿ ಗ್ರೀವಿಯಸ್ ಇಂಜುರಿ ಆಗುತ್ತೆ, ಸೀರಿಯಸ್ ಇಂಜುರಿ ಆಗುತ್ತೆ. ಆಮೇಲೆ ಇವತ್ತೊಬ್ರು ಹಿರಿಯ ನಾಗರಿಕರು ಬಿದ್ದಿದ್ದಾರೆ ಅಂದ್ರೆ, ಕೇವಲ ಬಿದ್ದಿದ್ದಾರೆ ಅಂದ್ರೆ ಅವ್ರಿಗೆ ಮೇಜರ್ ಪ್ರಾಬ್ಲಮ್ ಇರಬಹುದು. ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ದಿಂದ ಬೀಳ್ಬಹುದು, ಅಥವಾ ನಿಮೋನಿಯಾ ಇದ್ದಲ್ಲಿ ಬೀಳ್ಬಹುದು, ಅಥವಾ ಸ್ಟ್ರೋಕ್ ಆದಲ್ಲಿ ಬೀಳ್ಬಹುದು. ಹಿಂಗೆ ಅನೇಕ ಕಾರಣಗಳು ಇರ್ತವೆ. ಅವರು ಎಷ್ಟೋ ಸಲ ಎದೆ ನೋವು ಅಂತ ಬರೋದಿಲ್ಲ, ಬಿದ್ರು ಮನೆಯಲ್ಲಿ ಬಾತ್ರೂಮ್ ಅಲ್ಲಿ ಬಿದ್ರು, ಬೆಳಿಗ್ಗೆ ಬಾತ್ರೂಮ್ ಹೋಗಿದ್ರು ಬಿದ್ರು, ECG ಮಾಡಿ ನೋಡಿದ್ರೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್. ಹಿಂಗೆ ಇರುತ್ತೆ. ಅದಕ್ಕೆ ಓಲ್ಡ್ ಏಜ್ ಅಲ್ಲಿ ಬೀಳುವಿಕೆಯನ್ನು ನಾವು ಏಕದಮ್ ಸಾಮಾನ್ಯವಾಗಿ ಪರಿಗಣಿಸುವಂಗಿಲ್ಲ. ಇದು ಒಂದು ಮೇಜರ್ ಇಶ್ಯೂ. ಯು ಹ್ಯಾವ್ ಟು ಕನ್ಸಲ್ಟ್ ಅ ಡಾಕ್ಟರ್ ಇಫ್ ಯು ಹ್ಯಾಡ್ ಅ ಫಾಲ್, because falls lead to hospitalization. Hospitalization leads to immobilization again for some time, and multiple diseases, multiple treatment, again they can have some more issues. So falls is not as easy as we discuss here. Only the difficulties faced by the person who had a fall we can understand. So as I was telling you, it multifactorial and it needs a multidisciplinary team. And today's program, we are going to highlight on prevention, how fall can be prevented. That is more important than what is done after the fall. That is a different issue. So ನಮ್ಮ ಕಡೆ ಒಬ್ರು ಹಿರಿಯರು ಬಂದಿದ್ರು, 70 ವರ್ಷದವರು. ಅವರಿಗೆ ಜ್ವರ, ಕೆಮ್ಮು, ನೆಗಡಿ ಇತ್ತು 5 days, and he was conscious. He was well oriented and he has a good activity of, he was moving around in home with this, despite his having fear and all. He didn't had any past history of falls, and we did investigations and treated him. He had a prostate enlargement, kalmadi jagake one prostate enlargement hiriya nagarikal iriddu, for which he was advised by his son to use the catheter, that is condom catheter. So condom drainage ಅಂತ ಬರುತ್ತೆ, condom ಮೇಲೆ catheter ಹಾಕಿ ನೈಟ್ ಮಲಗುವಾಗ ಡ್ರೈನೇಜ್ ಹಾಕೊಳ್ಳೋದು, ಬೆಳಿಗ್ಗೆ ತೆಗೆದು ಬಿಡೋದು. So this was practiced earlier. Then after looking at this, I told his son, why you want to put this? Use the diapers, that will be better, or get up until you get treated for prostate hypertrophy, at least use diapers. So he said nothing doing, but we treated him for only fever and cough. Then what happened, third day of his treatment on for fever and all, he was recovering. But what did happen in home, somebody rang the bell in the morning 7 o'clock, and this old man in hurriedly went to open the door without knowledge that he has got a catheter. ಅಯ್ಯೋ, catheter ಅಲ್ಲಿ ಇದ್ದಲ್ಲಿ ಅದು ಕಾಲಲ್ಲಿ ಸಿಕ್ಬಿದ್ದು ಉರುಳಿ ಬಿದ್ದು ICU ಅಲ್ಲಿ ಅಡ್ಮಿಟ್ ಆದ. So this was purely and preventable fall, but many people don't listen to us. So that is what this is case scenario tells us. So anything, every day you are used to that. ಯಾರ್ಯಾರು ಬಾಕ್ಲ ಬಡದ್ರದ ತಟ್ಟನೆ ನೀವು ಹೇಳ್ತೀರಿ, ಹೋಗಿ ಬಾಕ್ಲ ಬಡಿತೀರಿ. ಅದೇ ರೀತಿಯಲ್ಲಿ ಆ ದಿವಸ ನಿಮ್ಗೆ ಕ್ಯಾಥೆಟರ್ ಇದೆ, ಅಥವಾ ಯಾರಾದ್ರೂ ಮನೆಯಲ್ಲಿ ನೀರು ಚೆಲ್ಲಿದ್ದಾರೆ, ಅದು ನಿಮ್ಗೆ ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಅವಾಗ ಏನ್ ಮಾಡ್ತೀರಿ, ಕಾಲ್ ಜಾರ್ದು ಬಿಡ್ತೀರಿ. ಇದು ಬಹಳ ಮಹತ್ವದ್ದು. ಇಂಥವೆಲ್ಲ we can prevent. The another old man, he fall in bathroom at around early morning hours, but it was noticed by the daughter-in-law at 6:30 AM. When she woke up, ಅದು ಅಜ್ಜ ಅವರು ಬೆದ್ದು ನೆರಳ್ತಾ ಇದ್ರು, ಅಯ್ಯೋ ಅಯ್ಯೋ ಅಂತ. ಅದು ಹೋಗಿ ನೋಡಿದ್ರೆ ಬಾತ್ರೂಮ್ ಅಲ್ಲಿ ಇಮಿಡಿಯೇಟ್ಲಿ ಬಿದ್ದಾರ ಅಂತ. He was taken to the hospital, to the orthopedic, our medical college hospital, and immediately he was attended by orthopedic surgeon, and X-ray showed fracture femur. So that is a common fracture neck femur, long bones. Then at 9:30, the patient became breathless, and we were called to examine the patient. Then by the time ECG was done, it was showing heart attack, acute myocardial infarction. So what we are trying to tell you that fall can be due to even heart attack. Okay, fall can be a presenting feature of an heart attack, especially in the early morning hours, when you put lot of pressure to pass urine or pass stools like constipation. So this old man had an heart attack, which has led to a fall, then fracture. Because of he had early morning, delayed detection of the fracture was there. It has led to heart failure by 4 hours or 5 hours after admission, and he presented breathlessness. Of course, he was treated well and he survived and went home walking. But what I am trying to tell you is falls should not be taken lightly. Anything is possible with the fall in older person. Now, whenever an old man has a fall, what should be our goals? Not only from the doctor's point of view, from the person's point of view and the person's family point of view. Manage the current issue, tide over the crisis. What has happened? Okay, do it correctly. Don't delay for surgery. ಇವತ್ತೊಂದು ವಿಷಯ ಹೇಳ್ಬೇಕಂದ್ರೆ ಆಪರೇಷನ್ಗೆ ಡಿಲೇ ಮಾಡಿಸ್ಬೇಡಿ. ಎಷ್ಟು ಬೇಗನೆ ನೀವು ಆಪರೇಷನ್ ಮಾಡಿಸ್ತೀರಿ ಅಷ್ಟು ಬೇಗನೆ ಗುಣ ಆಗ್ತೀರಿ. Don't wait for somebody to take a decision. My son will come, my daughter will come, then they will decide. Don't do that. If there delay in management, there delay in prognosis also. And always try, be motivated. And whenever you go and meet a friend of yours who had a fall related injuries, go and motivate him that come, let's start walking. That's what they do. And why did he fall in the home? That all should be modified. Okay, most of the time the falls are in either in the home or in the community. And next time you have to prevent another fall. So we had one patient who was operated at the age of 70 years. And she had some issues with a lot of health issues. We corrected it. She underwent a surgery after 10 days of fall. And she recovered well. She went home with a walker. And in home, after 10 days, she went to remove some issue from instruments from her cupboard. And she had another fall. So that should not happen. Once the old man develops a fall, gets well, goes home walking, should always ensure you should not fall again, because that will lead to bedridden in next stage. Okay, so that is what should be our goals. Now, ಬೀಳುವಿಕೆ ಅಂದ್ರೆ ಏನು? It's an unexpected event in which the participant comes to rest on the ground, floor or other level, that we all know. Now, why we should discuss, as Jambunathan sir told, why it is important? Because it is second leading cause of unintentional injury deaths worldwide. Falls lead to death. No, and adults older than 60, the senior citizens, suffer the greatest number of fatal falls. ಈಗ ಎಷ್ಟೋ ಜನ ಹಿರಿಯ ನಾಗರಿಕರು ಬೇರೆ ಬೇರೆ ಕಾಯಿಲೆ ಸಲುವಾಗಿ ಮಾತ್ರೆ ತಗೋತಾ ಇದ್ದಾರೆ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಹೃದಯ ರೋಗ ಸಂಬಂಧ ಆಸ್ಪಿರಿನ್ ತಗೋತಾ ಇರ್ತಾರೆ. ಅದು ರಕ್ತ ತಿಳಿ ಮಾಡೋದು ಕೆಲಸ. ಅದು ಈವನ್ ನೀವು ಬಹಳ ಜೋರಾಗಿ ಬೀಳೋದು ಬೇಕಾಗುದಿಲ್ಲ. ಸಣ್ಣಗೆ ನೀವು ಬಿದ್ರಿ ಅಥವಾ ಸಣ್ಣ ಪ್ರಮಾಣದಲ್ಲಿ ಪೆಟ್ಟು ಬಿತ್ತು ಮೆದುಳಿಗೆ ಅಂದ್ರೂ ಒಳಗೆ ಬ್ಲೀಡ್ ಆಗುತ್ತೆ, ಹೆಮರೇಜ್ ಆಗುತ್ತೆ. So that is one of the risk factors. That's why we are telling you fall is a different issue, preventing fall a different issue, and what happens after falls is a different issue. So if you start dissecting, fall is a very complicated issue, right? So even a small injury, a small impact can lead to bleed in the brain and the patient can come with stroke. So ನಾನು ವಯಸ್ಸಾಗಿದ್ದೀನಿ, ನನಗೆ ವಯಸ್ಸಾಗಿದೆ, ನಾನು ಬೀಳ್ತೀನಪ್ಪ ಅನ್ನೋದು ಸುಳ್ಳು. Being old is not a risk factor for fall. That's what I was telling you. Not all persons fall. Okay, so just being old is not a risk factor. And some changes as we grow old, some changes happens, like ಹೆಣ್ಮಕ್ಳಲ್ಲಿ narrow based gait, ಗಂಡಸರಲ್ಲಿ wide based gait ಆಗುತ್ತೆ, short step, which we are not used to in middle age. So this change in the gait may predispose us for a fall when you are in hurry. Okay, increased postural sway, ಯಾವಾಗೋ ಸ್ವಲ್ಪ ಮೈ ಜೋಲ್ ಹೋಗ್ತಾ ಇರುತ್ತೆ, ಅದು ಸ್ವಲ್ಪ ಸ್ವೇಯಿಂಗ್ ಆಗುತ್ತೆ ಹೇಳ್ತೇವೆ. Diminished strength of muscles is very very important. ಎಷ್ಟೋ ಜನ ಹಿರಿಯರು ವೇಟ್ ಲಾಸ್ ಮಾಡಬೇಕು, ನಾನು ತುಂಬಾ ದಪ್ಪ ಆಗಿದ್ದೀನಿ, ಊಟ ಕಡಿಮೆ ಮಾಡಬೇಕು ಎಂತಾವ್ ಎಲ್ಲ ಫ್ಯಾಟ್ಸ್ ಇಟ್ಕೊಂಡು ಇರ್ತಾರೆ. ಅದೆಲ್ಲ ಸರಿ ಅಲ್ಲ. When we lose weight, we lose muscle mass. That is very very important. Please try to understand. Unless you are not obese or that excess weight is causing problem for you, please don't reduce weight. That is going to create more issues for you than helping. So as we grow old, the muscle mass already start going down. ಇಷ್ಟರಲ್ಲೇ ಮತ್ತೆ ನೀವು ಅಲ್ಲ ನಾ ಊಟ ಕಡಿಮೆ ಮಾಡ್ತೀನಿ, ರಾತ್ರಿ ಏನೋ ತಿನ್ನೋದಿಲ್ಲ, ನನಗೆ ಬೇಡ, ಅದೆಲ್ಲ ಹಂಗೆ ಮಾಡಬೇಡಿ. The more you have strength in the muscles, the more powerful you are and you will not likely to fall. Environmental hazard or unexpected trip, ಎಲ್ಲಿ ನಾವು ಬೀಳ್ತೀವಿ ಗೊತ್ತಿಲ್ಲ. ಮಂಗಲ್ ಕಾರ್ಯದಲ್ಲಿ ಲಗ್ನಕ್ಕೆ ಹೋಗಿರ್ತೀವಿ, ಅಲ್ಲಿ ಬೀಳ್ತೀವಿ. ಆಸ್ಪತ್ರೆಗೆ ಬಂದಿರ್ತೀವಿ, ಅಲ್ಲಿ ಕಾಲು ಜಾರಿ ಬೀಳ್ತೀವಿ. ಮನೆಯಲ್ಲೇ ಮೊಮ್ಮಕ್ಕಳು ಎಲ್ಲಾದ್ರೂ ನೀರ್ ಚೆಲ್ಲಿದ್ರು ಅಥವಾ ಮೊಮ್ಮಕ್ಕಳೆಲ್ಲರೂ ಉಚ್ಚಿ ಒಯ್ದಿರ್ತಾರೆ ರೂಮ್ ಅಲ್ಲಿ, ಅದು ಕಾಣಿಸೋದೇ ಇಲ್ಲ, ಅದ್ರ ಮೇಲೆ ಕಾಲಿಟ್ಟು ಬೀಳ್ತೀರಿ. ಬಾತ್ರೂಮ್ ಅಲ್ಲಿ ಏನೋ ತುಂಬಾ ಸಾಬಾನ್ ನೀರಿತ್ತು, ಅದರಲ್ಲಿ ಕಾಲ್ ಜಾರ್ ಬೀಳ್ತೀವಿ. Anything, anywhere it can happen. So unexpected falls can also happen in the home. So what I wanted to tell you is fall is not a single entity. It can be due to posture, loss of postural control, loss of sensory inputs, loss of central processing, and musculoskeletal impairment. ಇವು ನಾಲ್ಕುದಲ್ಲಿ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಆದಲ್ಲಿ ಹಿರಿಯರು ಬೀಳ್ತಾರೆ. ದಿಸ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಪೋಸ್ಚರ್ ಕಂಟ್ರೋಲ್ ಹೇಳಿದೆ, ಸ್ವೇಯಿಂಗ್ ಆಗುತ್ತೆ, ಸೆನ್ಸರ್ ಇನ್ಪುಟ್ಸ್, ಕಣ್ ಕಾಣಿಸ್ತಾ ಇಲ್ಲ, ಕಣ್ಣು ಮಂಜ್ ಆಗ್ಬಿಡುತ್ತೆ, ಅಥವಾ ನಿಮ್ಗೆ ಕೆಟ್ರಾಕ್ಟ್ ಪರಿ ಬಂದಿದೆ, ಇಂಥವೆಲ್ಲ ನಿಗ್ಲೆಕ್ಟ್ ಮಾಡಬಾರ್ದು. ಅದರಲ್ಲಿ ಕಣ್ಣು ಮಂಜು ಕಾಣಿಸ್ತಾ ಇದೆ ಅಂದ್ರೆ ತಕ್ಷಣ ಅದಕ್ಕೆ ಪರಿಹಾರ ಉಂಟು. ಸೆಂಟ್ರಲ್ ಪ್ರೊಸೆಸಿಂಗ್ ಯಾಕೆ ಆಗ್ತಾ ಇದೆ? ಹೆಚ್ಚು ಸಲ ಮಾತ್ರೆಗಳಿಂದ ಆಗುತ್ತೆ, ಕೆಲವೊಂದು ಕಾಲದಿಂದ ಆಗುತ್ತೆ. ದಿಸ್ ಇಸ್ ವಾಟ್ ಐ ವಾಸ್ ಟೆಲಿಂಗ್ ಯು. ಪೇನ್ ಇನ್ ದ ಜಾಯಿಂಟ್ಸ್, loss of muscle strength, all can contribute to fall. There is no one single thing that it can lead to fall. So all contributes to fall. That's why it is very difficult in some people to recover. ಎಷ್ಟೋ ಜನ ಹಿರಿಯರು ಬಹಳ ಸ್ಮಾರ್ಟ್ ಇರ್ತಾರೆ. ಎಷ್ಟೋ ವೈದ್ಯ ನಾವು ಕೇಳ್ತೀವಿ, ಬಂದವ್ರು ಹಿರಿಯ ಎಲ್ಲ ಬಂದವ್ರು ಕೇಳ್ತೀವಿ, ನೀವು ಬಿದ್ದಿದ್ರಾ ಲಾಸ್ಟ್ 1 ವರ್ಷದಲ್ಲಿ ಎಷ್ಟು ಸಲ ಬಿದ್ದಿದ್ದೀರಾ ಅಂದ್ರೆ ಹೇಳೋದಿಲ್ಲ. ನಾ ಯಾಕೆ ಹೇಳ್ಬೇಕು? ನಾನು ಹೇಳೋದಿಲ್ಲ, ನಾ ಬಿದ್ದೀನಿ, ವಯಸ್ಸಾಗಿದೆ, ಬಿದ್ದಿದ್ವಿ. ಬಟ್ falls are very costly. All of you please understand, falls are very, very costly. Any treatment varies in lakhs, depending upon the injury that you have. And later what will happen? It leads to loss of physical function, and some people become dependent on others. They lose the independence, and most of the times the family members sacrifice their job only to provide care for the person who had a fall and being bedded in the home. So a lot of issues takes place. Not only you are the treatment is costly, but one family member has to lose the job, and the other it's the treatment cost costly. It is very costly in general. Tumba costly. Falls is very costly in older people, and 40% of hospital admission leads to, and even after discharge, you and your family members need to be a lot of motivated only to ensure that you get well soon. You start walking back. Unless that motivation is there in you or the person who had a fall and the family members ಒಂದು 15 ದಿನ ರಜೆ ಹಾಕಿ ಅವ್ರ ಮನೆಯಲ್ಲಿದ್ದ ವಯಸ್ಕರನ್ನು ಅಥವಾ ಅಜ್ಜಾರನ್ನು ಸೇವೆ ಮಾಡ್ಬೇಕು. ಎದ್ದಿಸ್ಕೊಂಡ್ರು ಅವ್ರಿಗೆ ನಡೆಸ್ಲಿಕ್ಕೆ ಪ್ರಯತ್ನ ಮಾಡಬೇಕು, ಫಿಸಿಯೋಥೆರಪಿ ಕೊಡ್ಬೇಕು. ಇದೆಲ್ಲ ಆದಲ್ಲೇ ಔಟ್ಕಮ್ ಇಸ್ ವೆರಿ ಗುಡ್. ಅಥವಾ ಎಷ್ಟೋ ಜನ ನಾವು ಬರ್ತಾರೆ, ಸರ್ 5 ಲಕ್ಷ ಹಾಕಿ ಆಪರೇಷನ್ ಮಾಡಿದೀವಿ, ಆಪರೇಷನ್ ಸಕ್ಸಸ್ಫುಲ್, ಬಟ್ ಪೇಷಂಟ್ ಎದ್ದು ತಿರುಗಾಡ್ತಾನೆ ಇಲ್ಲ. So that should not happen. Okay, so after fall, after surgery, again motivation is required for, and you have to prevent another fall. So again, 2 things. Now ಹಿರಿಯ ನಾಗರಿಕರಲ್ಲಿ ಏನ್ ಮಾತಾಡ್ತೀವಿ ಅಂದ್ರೆ ಫಂಕ್ಷನಲ್ ಕೆಪಾಸಿಟಿ. ನೀವು ಇರುವವರೆಗೂ you should be active, you should be independent of yourself. And second is good quality of life. Both will deteriorate once you had a fall. And there is a loss of confidence. ಎಲ್ಲ ಬಂತು, ಆಪರೇಷನ್ ಆಗಿ ಬಂತು, ಚೆನ್ನಾಗಿ ಆಗಿದ್ದೇನೆ ಅಂದ್ರೂ ನಮ್ಮಲ್ಲಿ ಎಲ್ಲೋ ಒಂದು ಕಾನ್ಫಿಡೆನ್ಸ್ ಹೋಗುತ್ತೆ. ನಾ ಮತ್ತೆ ಬೀಳ್ತೀನೇನು, ಫಿಯರ್ ಆಫ್ ಫಾಲಿಂಗ್. 40% ಜನ, 100 ಆಪರೇಷನ್ ಆದಲ್ಲಿ 40 ಜನರಿಗೆ ಮತ್ತೆ ನಾನೇನೋ ಬೀಳ್ತೀನೇನೋ, ಮತ್ತೆ ಇನ್ನೊಂದು ಕಾಲು ಮುಳ್ಕೋತೀನೇನೋ ಅನ್ನೋದು ಅಂಜಿಕೆಯಲ್ಲಿ ಅವರು ಬೆಳಿಗ್ಗೆ ವಾಕಿಂಗ್ ಹೋಗೋದು ಬಿಡ್ತಾರೆ, ಅವರು ಸಮಾಜದಲ್ಲಿ ಅವರ ಎಲ್ಲ ಕಾರ್ಯಕ್ರಮಗಳು ಅಟೆಂಡ್ ಆಗದೆ ಬಿಡ್ತಾರೆ. ಹಿಂಗ ಆಗಬಾರದು. ಇದು ಬಹಳ ನೆಗೆಟಿವ್ ಇಂಪ್ಯಾಕ್ಟ್ ಬೀಳೋದ್ರಿಂದ ಆಗುತ್ತೆ. So loss of independence, I was telling you, decreased activity can increase joint stiffness and weakness, again further reducing the mobility. And 100ರಲ್ಲಿ 25 ಜನ ಮತ್ತೊಂದು ಬೋನ್ ಬ್ರೇಕ್ ಮಾಡ್ಕೋತಾರೆ ನೆಕ್ಸ್ಟ್ 5 ವರ್ಷದಲ್ಲಿ. And that's what I'm telling you, earlier the better. If there is a fall, immediately you should seek an health advice, and if surgery is advised, it should be done as early as possible. Don't delay, because a lot of complications can occur once the surgery is delayed from our side. Okay, so all these have impact on the older person's functional capacity, quality of life, independency. So now you have to become dependent on for everything you have to depend on others. ಯಾರೋ ಬಂದು ಡೈಪರ್ ಚೇಂಜ್ ಮಾಡಬೇಕು, ಯಾರೋ ಬಂದು ಸ್ನಾನ ಮಾಡಿಸ್ಬೇಕು, ಯಾರೋ ಬಂದು ತಿಂಡಿ ಕೊಡಬೇಕು, ಯಾರೋ ಬಂದು ಎಬ್ಬಿಸ್ಬೇಕು. This all can happen because of fall related injuries. That's why prevention is very, very important. We have to give importance to the prevention. Now, where we fall, where the older people commonly fall, okay, it's a bathroom. That's what I was telling you. The place where most of the older people fall is the bathroom or the restroom, what we call. That is in the early morning. Most of the times they get up in the early 4:35, they go to pee, they put pressure, or for the stools, again they put a pressure. And the moment they get up from the commode or the toilet, they get giddiness and they fall. Bedroom, kitchen, garden, footpath, yes. ಇತ್ತಿತ್ತಲಾಗೆ ಮ್ಯಾರೇಜ್ ಹೆಚ್ಚಾಗ್ತಾ ಇದೆ. ನಮ್ಮಲ್ಲಿ ಬಿಜಾಪುರಲ್ಲಿ ತುಂಬಾ ಕಾಮನ್. ಮ್ಯಾರೇಜ್ ಹಾಲ್ ಅಲ್ಲಿ ಬೀಳುವುದು ಬಹಳ ಕಾಮನ್. ಪ್ರತಿ ತಿಂಗಳಿಗೆ ಮ್ಯಾರೇಜ್ ಇದ್ದಲ್ಲಿ ಪ್ರತಿ ವಾರ ಒಂದು ಕೇಸ್ ನಮ್ಮಲ್ಲಿ ಬಂದೇ ಬರುತ್ತೆ. ಯಾಕೆಂದ್ರೆ ಕೈ ತೊಳ್ಕೊಳಕ್ ಹೋಗಿದ್ದೆ, ಊಟ ಮಾಡಿ ಕೈ ತೊಳ್ಕೋದಲ್ಲಿ ನೀರ್ ನಿಂತಿತ್ತು, ನೀರ್ ಕಾಣಿಸ್ಲಿಲ್ಲ, ಜಾರಿ ಬಿದ್ದೆ. ಸೊ ದಿಸ್ ಇಸ್ ವೆರಿ ಕಾಮನ್ ಇನ್ ಮ್ಯಾರೇಜ್ ಹಾಲ್ಸ್. And even tripping because of those flooring, they are not good. So older person should be very, very careful when they go to attend a marriage, wherever the social functions are there, especially the area where hand wash is there, a lot of water spillage is there, and most of the older people fall there. And change of home. ಈಗ ಯಾರು ಹಿರಿಯರು ತಮ್ಮ ಏನೋ ಬೇರೆ ಊರಿಗೆ ಹೋಗ್ತಾರೆ, ತಮ್ಮ ರಿಲೇಟಿವ್ಸ್ ಇದ್ದಾರೆ ಅಥವಾ ಮಗ ಇದ್ದಾನೆ, ಮಗಳಿದ್ದಾನೆ, that is again one of the risk factor for fall. Because you are so much used to your own home, you know, even in the early hours also, even in decreased in area of mindfulness also, you know when to take the turn, where is the kitchen, where is the bathroom. When you go to the new place, that again creates a problem. So you will be facing problem because you will either there is one hurdle, or there is a cable or wire, something is there which you are not aware and you fall. So these are also common. ತುಂಬಾ ಜನ ಬರ್ತಾರೆ ನಮ್ಮ ತಿಂಗಳಿಗೆ ಒಬ್ಬರಾದ್ರೂ, ನಾವು ಬೇರೆ ಊರಿಂದ ಬಂದಿದ್ದೀವಿ ಸರ್, ಮಗಳ ಲಗ್ನ ಇತ್ತು ಅಥವಾ ರಿಲೇಟಿವ್ ಮ್ಯಾರೇಜ್ ಇತ್ತು, ಅವ್ರ ಮನೆಯಲ್ಲಿ ಬಿದ್ರು. ದಿಸ್ ಇಸ್ ಕಾಮನ್. ಸೊ ಅವರಲ್ಲಿ ಅಲ್ಲಿ ಕೂಡ older person has to be careful, has to wear his goggle. ಚಸ್ಮಾ ಹಾಕೊಂಡೇ ಇರ್ಬೇಕು. ಬೇರೆ ಮನೆಯಲ್ಲಿ ಹೋದ್ರು ಚಸ್ಮಾ ಹಾಕೊಂಡೇ ತಿರುಗಾಡ್ರಿ. ಎಲ್ಲೇ ಏನೇ ಹೊಸಾಗಿತ್ತಂದ್ರು ಸ್ವಲ್ಪ ನೋಡಿ ನಿಧಾನವಾಗಿ ತಿರುಗಾಡ್ಬೇಕು. ಇದು ಬಿದ್ದ ಕೂಡಲೇ ಏನಾಗುತ್ತಪ್ಪ ಅಂದ್ರೆ ಫ್ರಾಕ್ಚರ್, ಲಾಂಗ್ ಬೋನ್ಸ್ ಫ್ರಾಕ್ಚರ್ ಅಂತೀವಿ, ಫ್ರಾಕ್ಚರ್ ನೆಕ್ ಫಿಮರ್ ಅಥವಾ ಸ್ಪೈನ್ ಬೋನ್ ಮೊಳೆ, ಇದನ್ನು ಕೂಡ ಫ್ರಾಕ್ಚರ್ ಆಗಬಹುದು. ಇದು ಬೆಕ್ಕದ ಬೋನ್ ಫ್ರಾಕ್ಚರ್ ಆಗಬಹುದು, ಬಟ್ ದೀಸ್ ಆರ್ ದ ಮೋರ್ ಡೇಂಜರಸ್. ದಿಸ್ lady who has operated, again another fracture after 1 month. So this is the lady again ಬಿದ್ರು, ನಿಂತಲ್ಲೇ ಕೂತ್ ಬಿಡ್ತಾರೆ ಕಚಕನೆ ಅಂತೆ. ಅವ್ರು ಹೇಳ್ತಾರೆ, ನಾನು ಬಿದ್ದಿಲ್ಲ ಸರ್, ನಾನು ಬಿದ್ದಿಲ್ಲ, ನಾನು ಸುಮ್ನೆ ಹಿಂಗೆ ಕೂತ್ ಬಿಟ್ಟೆ, ಸುಮ್ನೆ ಗಸಕನೆ ಕೂತ್ ಬಿಟ್ಟೆ. ಸೊ ದಟ್ ಈಸ್ ಮೋರ್ ಡೇಂಜರಸ್. that will fracture the bones in the spine. ಓಕೆ, ಬಿದ್ರೆ ಈಗ ಮನೆಯಲ್ಲಿ ನಾವು ವಯಸ್ಸಾದವರು ಹಿಂಗೆ ಬೀಳ್ತಾರೆ. ಸೊ ಹಿಂಗ್ ಜಾರಿ ಹಿಂದಿನ ಸೈಡ್ ಬೀಳ್ತಾರೆ, ಅದಕ್ಕೆ ಈ ಕಡೆ ಫ್ರಾಕ್ಚರ್ ಆಗುತ್ತೆ. ಅದೇ ಯಂಗ್ಸ್ಟರ್ಸ್ ಬೀಳ್ಬೇಕಾದ್ರೆ ಮುಂದೆ ಬೀಳ್ತಾರೆ ಹಿಂಗೇನಾದ್ರೂ ಆದ್ರೆ. ಸೊ ಕೈಯಲ್ಲಿ ಫ್ರಾಕ್ಚರ್ ಹೆಚ್ಚು ಕಾಮನ್, ವಯಸ್ಕರದಲ್ಲಿ ಕಾಲಲ್ಲಿ ಫ್ರಾಕ್ಚರ್ ಹೆಚ್ಚು ಕಾಮನ್. ಆಮೇಲೆ ಹಿಂಗೆ ಗಸಕನೆ ಕೂತ್ರಂದ್ರೆ, ಸೊ ದೇ ವಿಲ್ ಹ್ಯಾವ್ ಅ ಫ್ರಾಕ್ಚರ್ ಇನ್ ದಿಸ್ ಬೋನ್, ಸೊ vertebral bodies. So this is how the fall takes place. ಇದರಲ್ಲಿ ಆದಾಗ ಏನಂತಾರೆ, ಇಲ್ಲ ಸರ್ ನಾನು ಬಿದ್ದಿಲ್ಲ, ನಾನು ಸುಮ್ಮನೆ ಕೂತ್ಬಿಟ್ಟೆ, ಗಸಕನೆ ಕೂತ್ಬಿಟ್ಟೆ, ಅವಾಗಿಂದ ನೋವು ಬರ್ತಾ ಇದೆ. ಸೊ ಟೇಕ್ ಅನ್ ಎಕ್ಸ್ರೇ, there is a fracture. So this will create a lot of negative impact on older persons. ಸೊ ಏನಪ್ಪ ನಾವು ಯಾಕೆ ಬೀಳ್ತೀವಿ? ಅನೇಕ ಕಾರಣ ಇದಾವೆ. ಜಾಯಿಂಟ್ ಅಲ್ಲಿ ಇನ್ಫ್ಲಮೇಷನ್ ಇರೋದು ಅಥವಾ ಏನಾದ್ರು ಇನ್ಫೆಕ್ಷನ್ ಇದೆ, BP ಹೆಚ್ಚ ಕಡಿಮೆ ಆಗ್ತಾ ಇದೆ, ನಾ ಹೇಳ್ತಾ ಇದೆ ಆರ್ಥೋಸ್ಟಾಟಿಕ್ ಹೈಪೋಟೆನ್ಷನ್ ಅಂತೀವಿ. ಕೆಲವೊಂದು BP ಮಾತ್ರೆಯಿಂದ BP ಹೆಚ್ಚ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಅಂದ್ರೆ ನೀವು ಮಲ್ಕೊಂಡು ಎದ್ ಕೂಡ್ಲೆ ಚಕ್ರ ಬರೋದು, ಅಥವಾ ಬಹಳ ಹೊತ್ತು ಕುರ್ಚಿ ಮ್ಯಾಗ ಕುಂತಿರ್ತೀರಿ, ಅವಾಗ ಎದ್ ನಿಂತ ಕೂಡಲೇ ಚಕ್ರ ಬರೋದು. ಇದು ಏನ್ ಹೇಳ್ತಪ್ಪ ಅಂತಂದ್ರೆ ದೇರ್ ಇಸ್ ಅನ್ ಡ್ರಾಪ್ ಇನ್ ಬ್ಲಡ್ ಪ್ರೆಷರ್, ಆರ್ಥೋಸ್ಟಾಟಿಕ್ ಹೈಪೋಟೆನ್ಷನ್ ಅಂತಾರೆ. ಆಮೇಲೆ ಯಾರಿಗೆ ಕಣ್ ಕಾಣಿಸೋದಿಲ್ಲ, ಯಾರಿಗೆ ಕಿವಿ ಸರಿಯಾಗಿ ಕೇಳಿಸೋದಿಲ್ಲ, ಆಮೇಲೆ ಯಾರಿಗೆ ಪಾರ್ಕಿನ್ಸನ್ ಇಂದ ಬೆಳುತ್ತಿದ್ದಾರೆ, ಆಮೇಲೆ ಕೆಲವೊಬ್ಬರಿಗೆ ಕಾಲಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಇರುತ್ತೆ, ಆಮೇಲೆ ಹೃದಯ ತೊಂದರೆ ಇರುತ್ತೆ, ಆಮೇಲೆ ವೀಕ್ನೆಸ್, ಜನರಲ್ ವೀಕ್ನೆಸ್, ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್, ನ್ಯೂಮೋನಿಯಾ, ಯೂರಿಯಾಟ್ರಾಕ್ಟ್ ಇನ್ಫೆಕ್ಷನ್, ಇವೆಲ್ಲ ಕೂಡ ಇದರಿಂದ ಬೀಳುವಿಕೆ ಆಗೋ ಚಾನ್ಸಸ್ ಇರ್ತವೆ. ನ್ಯೂಟ್ರಿಷನ್ ಹೇಳ್ತಾ ಇದೆ, ವೇಟ್ ಲಾಸ್, ಸುಮ್ಮನೆ ಎಲ್ಲರೂ ಫ್ಯಾಡ್, ನಾನು ತುಂಬಾ ವೇಟ್ ಇದ್ದೀನಿ, ಬೇಡ, ವೇಟ್ ಲಾಸ್ ಮಾಡೇಬೇಡಿ. ಎಷ್ಟು ಓವರ್ ವೇಟ್ ಅಥವಾ ಒಬೇಸ್ ಇದ್ರೆ ಅಷ್ಟೇ ನೀವು ಕಂಟ್ರೋಲ್ ಮಾಡಿ ಅಥವಾ ಕಡಿಮೆ ಮಾಡಿ. Otherwise, you don't have to lose weight, because it will create more problem in your future life. And gate disturbance, like ನೀವು ಹೋಗ್ಬೇಕಾದ್ರೆ ಜೋಲ್ ಹೋಗ್ತಾ ಇದೆ, ಅದೆಲ್ಲ ಗೇಟ್ ಡಿಸ್ಟರ್ಬೆನ್ಸ್ ಅಲ್ಲಿ ಕೂಡ ಇದರಿಂದ ನಾವು ಹೆಚ್ಚಿನ ಹಿರಿಯ ನಾಗರಿಕರು ಬೀಳ್ತಾರೆ. ನಾವು ಇದಕ್ಕೆ ಫಾಲು ನಾವು ಜಿರಾಟ್ರಿಕ್ ಮೆಡಿಸಿನ್ ಅಲ್ಲಿ ಜಿರಾಟ್ರಿಕ್ ಜಾಯಿಂಟ್ ಅಂತ ಪರಿಗಣಿಸ್ತೀವಿ. ಇದು ಜಿರಾಟ್ರಿಕ್ ಜಾಯಿಂಟ್ ಯಾಕೆ ಅಂತೀವಿ ಅಂದ್ರೆ, ಜಾಯಿಂಟ್ ಅಂದ್ರೆ ಯಾಕೆ ಅಂತೀವಿ ಅಂದ್ರೆ, ಇದಕ್ಕೆ ಕಾರಣ ಹೃದಯಘಾತ, ನಿಮೋನಿಯಾ, ಕಫ, ಯೂರಿಯಾಟ್ರಾಕ್ಟ್ ಇನ್ಫೆಕ್ಷನ್, stroke, anything can lead to fall. ಅದಕ್ಕೆ ನಾವು ಅದಕ್ಕೆ ಜಾಯಿಂಟ್ ಅಂತ ಕರಿತೀವಿ. ಓಕೆ, ಹೃದಯಘಾತದಿಂದನೂ ಬೀಳ್ಬಹುದು, ನಿಮೋನಿಯಾ ಇರೋದ್ರಿಂದ ಬೀಳ್ಬಹುದು, ಕಾಲ್ಮಡಿಯಲ್ಲಿ ಇನ್ಫೆಕ್ಷನ್ ಆದ್ರೂ ಕೂಡ ಮನುಷ್ಯರು ಬೀಳ್ಬಹುದು. ಆ ದೃಷ್ಟಿಯಿಂದ ನಾವು ಫಾಲ್ ಅನ್ನು ಜಿರಾಟ್ರಿಕ್ ಜಾಯಿಂಟ್ ಅಂತ ಪರಿಗಣಿಸ್ತೀವಿ. ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಏನಪ್ಪಾ, ಯಾರೆಲ್ಲ ಬೀಳ್ಬೋತಾರೆ, ಯಾರು ಬೀಳ್ತಾರೆ? ಪಾಸ್ ಹಿಸ್ಟ್ರಿ ಆಫ್ ಫಾಲ್ ಇದ್ದಲ್ಲಿ, ಯಾರು ಮೊದಲು ಬಿದ್ದಿದ್ದಾರೆ 6 months ಬಿಫೋರ್, 3 months ಬಿಫೋರ್, 1 ವರ್ಷ ಮೊದಲು ಬಿದ್ದಿದ್ದಾರೆ ಅಂದ್ರೆ ಅವರು ಇನ್ನೊಮ್ಮೆ ಬೀಳೋ ಚಾನ್ಸಸ್ ಬಹಳ. ಅದಕ್ಕೆ ಡೋಂಟ್ ಹೈಡ್ ದಟ್ ಯು ಹ್ಯಾಡ್ ಅ ಫಾಲ್ ಇನ್ ದ ಪಾಸ್ ವೆನ್ ಯು ಗೋ ಟು ಡಾಕ್ಟರ್. ಟೆಲ್ ಹಿಮ್ ಸೊ ದಟ್ ಅಟ್ ಲೀಸ್ಟ್ ಯು ವಿಲ್ ಫೈಂಡ್ ದ ಕಾಸ್. ಹೆಚ್ಚಿನ ನಮ್ಮ ಸಂಖ್ಯೆಯಲ್ಲಿ ಮಾತ್ರೆ ತಗೋತಾ ಇದ್ರು, ಪಾಲಿಫಾರ್ಮಾಸ್ ಅಂತೀವಿ, ಕೆಲವೊಂದು ನಿದ್ದೆ ಮಾತ್ರೆ ಆಂಟಿಸೈಕೋಟಿಕ್ಸ್ ಅಂತೀವಿ, ಅದರಿಂದ ಕೂಡ ನಾವು ಬೀಳ್ಬಹುದು. ಕಾನ್ಸ್ಟಿಪೇಷನ್ ಟೆಲಿಂಗ್ ಯು, ಸಿವಿಯರ್ ಪ್ರೆಷರ್ ಹಾಕಿ ಸ್ಟೂಲ್ಸ್ ಪಾಸ್ ಮಾಡಬಹುದು. ಅದರಿಂದ ನೀವು ಎದ್ ನಿಂತ್ ಕೂಡಲೇ ಕಮೋಡ್ದಿಂದ ಎದ್ ನಿಂತಿರಿ ಅಥವಾ ಇಂಡಿಯನ್ ಟಾಯ್ಲೆಟ್ ಎದ್ ನಿಂತಿರಲ್ಲ, ಅವಾಗ ಚಕ್ರ ಬರುತ್ತೆ, ಚಕ್ರ ಬಂದು ಬೀಳ್ತೀರಿ. ಅದು ಯಾಕೆಂದ್ರೆ ಕಾನ್ಸ್ಟಿಪೇಷನ್, ಬಿಕಾಸ್ ಯು ಪುಟ್ ಅ ಲಾಟ್ ಆಫ್ ಪ್ರೆಷರ್ ಇನ್ ರಿಮೂವಿಂಗ್ ದ ಸ್ಟೂಲ್ಸ್. ಹೈಪೋಗ್ಲೈಸಿಮಿಯಾ ಅಂದ್ರೆ ಸಕ್ಕರೆ ಮಾತ್ರೆ ಕಡಿಮೆ ಆಗೋದು. ಸಕ್ಕರೆ ಕಾಯಿಲೆ ಇದ್ದವರು ಸಕ್ಕರೆ ಮಾತ್ರೆ ಕಡಿಮೆ ಆದಲ್ಲಿ, when blood sugar levels comes less than 50, hypoglycemia, then they can lead to fall. ಯೂರಿನರಿ ಇನ್ಕಾಂಟಿನೆನ್ಸ್ ಅಂದ್ರೆ ಯೂರಿನ್ ಕಂಟ್ರೋಲ್ ಇಲ್ಲ, ಮೈ ಮೇಲೆ ಹೋಗುತ್ತೆ, ಸ್ವಲ್ಪ ಯೂರಿನ್ ಬಂದ್ ಕೂಡಲೇ ಓಡ್ಕೊತ ಹೋಗ್ಬೇಕು ಟಾಯ್ಲೆಟ್ಗೆ, ಅರೆ ನಡಿ ಯೂರಿನ್ ಬತ್ತು ಹೋಗಿ ಯೂರಿನ್ ಮಾಡೋದು. ಆಮೇಲೆ ಪೋಸ್ಟ್ ಪ್ಯಾಂಡಲ್ ಹೈಪೋಟೆನ್ಷನ್ ಅಂತಾರೆ, ಅಂದ್ರೆ ಊಟದಂತಾರೆ ಹೆವಿ ಊಟ ಮಾಡಿದ ಕೂಡಲೇ ನೀವು ಎದ್ ನಿಂತ ಕೂಡಲೇ ಚಕ್ರ ಬರುತ್ತೆ, ಜೋರ್ ಹೋಗುತ್ತೆ, ಅದಕ್ಕೆ ಪೋಸ್ಟ್ ಪ್ಯಾಂಡಲ್. ಅದಕ್ಕೆ ನಾವು ಸ್ಮಾಲ್ ಮೀಲ್ಸ್ ರಿಪೀಟೆಡ್ ಇನ್ ನಂಬರ್, ಇನ್ ಲಾರ್ಜ್ ನಂಬರ್ಸ್, ಸ್ಮಾಲ್ ಮೀಲ್ಸ್ ಇನ್ ಮೋರ್ ನಂಬರ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಫಾರ್ ದ ಲಾಂಗ್ ಟೈಮ್, ದಿಸ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಎಷ್ಟೋ ಜನ, ನಾ ಒಂದು ಎಕ್ಸಾಂಪಲ್ ಹೇಳ್ತೀನಿ, ಎಷ್ಟೋ ಜನ ಅವರು ಮದುವೆ ಸಮಾರಂಭದಲ್ಲಿ ಅಜ್ಜ ಅಜ್ಜಿಗಳು ಹಿಂದೆ ನಿಂತೆ ಬಿಟ್ಟಿರ್ತಾರೆ, 3 ಗಂಟೆ 2 ಗಂಟೆ 4 ಗಂಟೆ ಹಿಂಗೆ ನಿಂತಾರೆ, ಎಲ್ಲರ ಮಂದಿ ಬಂದು ವಿಶ್ ಮಾಡಿ ಹೋಗು. ನಾ ಎಷ್ಟೋ ಜನರನ್ನ ಹೋಗಿ ಹೇಳಿದ್ದೀನಿ, ನೀವು ನಿಂದ್ರಬಾರ್ದು, ಕುಂತ್ಕೊಳ್ಳಿ ಅಂತ. ಯಾಕಂದ್ರೆ ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಫಾರ್ ಲಾಂಗ್ ಟೈಮ್, ಅಗೇನ್ ನೀವು ಸ್ವಲ್ಪ ಮುಂದೆ ನಡೆದ್ರೆ ಜೋಲ್ ಹೋಗಿ ಬೀಳೋ ಚಾನ್ಸಸ್ ಬಹಳ ಇರ್ತಾವ, ಆಗಿದವನು ಕೂಡ. ವಿ ಹ್ಯಾವ್ ಸೀನ್ ಮೆನಿ ಓಲ್ಡರ್ ಪೀಪಲ್ ಹ್ಯಾಡ್ ಫಾಲ್ ಇನ್ ದ ಮ್ಯಾರೇಜ್ ಹಾಲ್. So that should not happen. Standing for the long time should not take place. For all the older people here, my request is don't stand for the long time. Every 30 minutes if you are standing, then may take a seat. Better to take a seat. Okay. Snoring, gorki. ಯಾರು ಗೊರ್ಕಿ ಹೊಡಿತಾರೆ ಅಂತ ಕೇಳಿದ್ರೆ ನಮಗೆ ಗೊತ್ತಿಲ್ಲ, ನಮ್ ಬೆಟರ್ ಹಾಫ್ ವಿಲ್ ಬಿ ನೋಯಿಂಗ್ ಹೂ ಇಸ್ ಸ್ನೋರಿಂಗ್. Okay, we never know we are snoring. Our wife will tell us, our husbands will tell us that you snore. Now snoring is also found to have a risk factor for fall because you don't get good night sleep. Okay, next day you are disturbed. ಒಂದು ಫೋನ್ ಕಾಲ್ ಬಂತು, ಏನು ಇಬ್ರೆ ಕಪಲ್, ಗಂಡ ಹೆಂಡತಿ ಇಬ್ರೆ ಇದ್ರು ಮನೆಯಲ್ಲಿ. ಆಮೇಲೆ ಅವರು ಮನೆಯವರು ಬಿದ್ರು, ಹಸ್ಬೆಂಡ್ ಹ್ಯಾಡ್ ಫಾಲ್ ಅಂಡ್ ವಿ ಹ್ಯಾಡ್ ಕಾಲ್, ವಿ ವೆಂಟ್ ಹೋಮ್ ಅಂಡ್ ಹಿ ಇಸ್ ಅನೇಬಲ್ ಟು ಗೆಟ್ ಅಪ್. ಆಮೇಲೆ ಅವ್ರು ನೋಡಿದ್ವಿ, ಅವ್ರ ಮನೆ ಹೋದಾಗ ಅವ್ರು ಬಾತ್ರೂಮ್ ಅಲ್ಲಿ ಬಿದ್ದಿದ್ರು. ಇವಾಗ ನಾವು ಏನ್ ಅಬ್ಸರ್ವ್ ಮಾಡ್ಬೇಕಂದ್ರೆ, ನಾವು ಕಾಲು ಇರ್ತೇಲ್ಲ ಹಿಂಗೆ, ಕಾಲು ಇಟ್ ಹ್ಯಾಸ್ ಟರ್ನ್ ಟು ದ ರೈಟ್ ಸೈಡ್ ಅಂಡ್ ಇಟ್ ಹ್ಯಾಸ್ ಬಿಕಮ್ ಸ್ಮಾಲರ್ ದೆನ್ ದ ಅದರ್ ಲೆಗ್ and he is unable to get up and he complains of severe pain here. This suggests that he has got a fracture. So ಅವಾಗ ನಾವು ಆಂಬ್ಯುಲೆನ್ಸ್ ಕರೆಸಿ ಅವರಿಗೆ ತುರ್ತವಾಗಿ ಅವರನ್ನು ಆಸ್ಪತ್ರೆಗೆ ಶಿಫ್ಟ್ ಮಾಡ್ತೀವಿ. ಬಟ್ ದಿಸ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ ವೆನ್ ದೇ ಫಾಲ್, ದೇ ಟ್ರೈ ಟು ಮೊಬಿಲೈಸ್ ಅಂಡ್ ಮೇಕ್ ದೆಮ್ ಸ್ಟ್ಯಾಂಡ್, ಮೇಕ್ ದೆಮ್ ಸಿಟ್, ಎಲ್ಲ ಏನೇನೋ ಟ್ರೈ ಮಾಡ್ತಾರೆ ಮನೇಲಿ. ಅದೆಲ್ಲ ಮಾಡಬಾರ್ದು. ನೀವು ಯಾರಾದ್ರೂ ನಿಮ್ಗೆ ಕರೆದ್ರು ಇವತ್ತು, ಇಲ್ಲ ಬೇರೆ ಬಿದ್ದಿದ್ದಾರೆ ನೋಡಿ ಬನ್ನಿ ಅಂದ್ರೆ, ಜಸ್ಟ್ ಗೋ ಅಂಡ್ ಸಿ. ಅವರು ಕಾಲಲ್ಲಿ ಸ್ಟ್ರೇಟ್ ಇರೋ ಬದಲಿ ಹಿಂಗೆ ರೈಟ್ ಸೈಡ್ ಕಾಲ್ ಬಿದ್ದಿದೆ, ಅಥವಾ ಆಮೇಲೆ ಸ್ಮಾಲ್ ಆಗಿದೆ, ಕಾಲ್ ಸಣ್ಣದಾಗಿದೆ, ನೋವಿದೆ, ತುಂಬಾ ನೋವಿದೆ ಇದರಲ್ಲಿ, ಇದು ಫ್ರಾಕ್ಚರ್ ಆಗುವ ಲಕ್ಷಣ. ತುರಂತ ಆಂಬ್ಯುಲೆನ್ಸ್ ತರಿಸಿ. ಆಂಬ್ಯುಲೆನ್ಸ್ ಅಲ್ಲಿ ಪ್ಯಾರಾಮೆಡಿಕ್ಸ್ ಇರ್ತಾರೆ, ದೇ ನೋ ಬೆಟರ್ ಹೌ ಟು ಲಿಫ್ಟ್ ದ ಪೇಷಂಟ್, ಹೌ ಟು ಪುಟ್ ಆನ್ ಸ್ಟ್ರೆಚರ್ ಅಂಡ್ ಹೌ ಟು ಶಿಫ್ಟ್. ನಾವು ಅದಕ್ಕೆ ಕೇಳ್ತಾ ಇರ್ತೀವಿ, ನೀವು ಬಿದ್ದಿದ್ರಾ, ಆಮೇಲೆ ಲಾಸ್ಟ್ 12 ತಿಂಗಳಲ್ಲಿ ಎಷ್ಟೆಲ್ಲ ಬಿದ್ದಿದ್ರ, ಇದು ಎಲ್ಲೇ ನೀವು ಹೋದ್ರು ವೈದ್ಯರು ನಿಮ್ಗೆ ಕೇಳ್ತಾರೆ. ಆಮೇಲೆ ನಿಮಗೆ ಕಾರ್ಡಿಯಾಕ್ ಸಿಂಕೋಪ್, ಕಣ್ಣಿನ ದೃಷ್ಟಿ, ಇದು ಒಂದು ತುಂಬಾ ವರ್ಷಕ್ಕೊಮ್ಮೆ ನೀವು ಕಣ್ಣಿನ ದೃಷ್ಟಿ ಚೆಕ್ ಮಾಡಿಸ್ಕೊತಾನೆ ಇರ್ಬೇಕು. ಆಮೇಲೆ ಹೋಮ್ ಸೇಫ್ಟಿ ಮೆಜರ್ಸ್ ನೋಡ್ಕೋತಾ ಇರ್ಬೇಕು, ಅದನ್ನ ಹೇಳ್ತೀನಿ ನಿಮಗೆ. ಎಲ್ಡರ್ ಅಬ್ಯೂಸ್ ಅಂತ, ನಾವು ಹಿರಿಯ ನಾಗರಿಕ ಮೇಲೆ ದೌರ್ಜನ್ಯ, ಇದ್ರು ಕೂಡ ಮನೆಯಲ್ಲಿ ಎಷ್ಟೋ ಮಂದಿ ನೋಡ್ತಿರ್ತೀವಿ ನಾವು, ಮಕ್ಕಳು ಅಥವಾ ಸ್ವಸ್ಥರು ಅವ್ರ ಅಜ್ಜರನ್ನು ದುಗಿಸ್ತಿರ್ತಾರೆ ಮನೆಯಲ್ಲಿ, ತುಂಬಾ ದುಗಿಸಿ ಬೀಳ್ಬೇಕಂತ ದುಗಿಸ್ತಿರ್ತಾರೆ. ಇದು ಕೂಡ ಇಂಥ ಕೇಸಸ್ ನಮ್ಮ ಜಿರಾಟಿಕ್ ಕ್ಲಿನಿಕ್ ಬರ್ತಾ ಇರ್ತವೆ. ಸೊ ಎನಿಥಿಂಗ್ ಈಸ್ ಪಾಸಿಬಲ್, ಮಲ್ಟಿಪಲ್ ಕಾಸಸ್. ಸೊ ಹಾರ್ಟ್, ಹೃದಯ ಸಂಬಂಧಿಗಿರ್ಬೋದು, ಅಥವಾ ನಿಮ್ಮ ಮನೆಯಲ್ಲೇ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡ್ಬೇಕು. ಮನೆಯಲ್ಲಿ ಎಲ್ಲ ನೀರ್ ಬಿದ್ದಿದೆಯೋ, ವೈರ್ ಬಿದ್ದಿದೆಯೋ, ಕ್ಲಚರ್ ಇದೆಯೇನೋ, ಅಥವಾ ಕಣ್ ಸರಿ ಕಾಣಿಸ್ತಾ ಇಲ್ಲೋ, ಇದೆಲ್ಲಾನು ಡಾಕ್ಟರ್ಗಳು ನಿಮ್ಗೆ ಹೋದಕೊಳ್ಳೆ ಕೇಳ್ತಾರೆ, ವೈದ್ಯರು ಕೇಳ್ತಾರೆ. ಇದಕ್ಕೆ ಸರಿ ಉತ್ತರ ಕೊಟ್ಟು ನೀವು ನಿಮ್ಮ ಇದು ಮಾಡ್ಕೋಬೇಕು, ಉಚ್ಚಾರ ಮಾಡ್ಕೋಬೇಕು. ಈಗ ಅಲ್ಲಿ ಹೋದ್ಕೊಳ್ಳಿ ಏನ್ ಮಾಡ್ತಾರೆ, ನೀವು ಬೀಳ್ತಿರೋ ಇಲ್ಲೋ ಅನ್ನೋದು ನೋಡ್ಲಿಕ್ಕೆ ಗೇಟ್ ಡಿಫಿಕಲ್ಟಿ ನೋಡ್ತಾರೆ, ಬ್ಯಾಲೆನ್ಸಿಂಗ್ ಕರೆಕ್ಟ್ ಇದೆಯೋ ಇಲ್ಲೋ, ಅಥವಾ ನಿಂತು ಆಮೇಲೆ ಮೊದಲು ಕುಂತು ಬಿ ಪಿ ನೋಡ್ತಾರೆ, ಆಮೇಲೆ ನಿಂದ್ರಿಸಿ ಬಿ ಪಿ ನೋಡ್ತಾರೆ. ಯಾಕೆ ನೋಡ್ತಾರೆ ಅಂದ್ರೆ ನಿಮಗೆ ಏನಾದ್ರು ಬಿ ಪಿ ಡೌನ್ ಆಗ್ತಾ ಇದೆನೋ, ಅಥವಾ ಒಂದು ಟೈಮ್ ಅಪ್ ಅಂಡ್ ಗೋ ಟೆಸ್ಟ್ ಅಂತಿದೆ. ಅದು ಏನ್ ಮಾಡ್ತಾರಪ್ಪ ಅಂದ್ರ ನಮ್ಮಲ್ಲಿ ನಾವು ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಪೇಷಂಟ್ ಹೇಳ್ಬೇಕು, ಕುರ್ಚಿ ಮೇಲೆ ಕೂತು ಆಮೇಲೆ ಎದ್ದು ಒಂದು ರೌಂಡ್ ಹೊಡಿಬೇಕು. ಎಷ್ಟು? 10 ಮೀಟರ್ಸ್, 10 ಮೀಟರ್ ರೌಂಡ್ ಹೊಡೋದು ಬರ್ಬೇಕು, ಮತ್ತೆ ಬಂದು ಕುರ್ಚಿ ಮೇಲೆ ಕುಂಡಿರ್ಬೇಕು. ಇದು 12 ಸೆಕೆಂಡ್ ಅಲ್ಲಿ ಆಗ್ಬೇಕು. ಇದು 12 ಸೆಕೆಂಡ್ ಅಲ್ಲಿ ಮಾಡಿದ್ರೆ ಹೀಸ್ ಹೆಲ್ತ್ ಇಸ್ ಗುಡ್. 12 ಸೆಕೆಂಡ್ ಕಿಂತ ಹೆಚ್ಚು ಮಾಡಿದ್ರೆ ಅಂದ್ರೆ ಇವರಿಗೆ ಅದ ಕಣ್ಣಿನ ದೃಷ್ಟಿಯಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಅಥವಾ ಮಸಲ್ಸ್ ಅಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಅಥವಾ ಜಾಯಿಂಟ್ಸ್ ಅಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಕಾಗ್ನಿಷನ್ ಮೆದುಳದಲ್ಲಿ ಕೂಡ ಪ್ರಾಬ್ಲಮ್ ಇರೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಇವರು ಬೀಳೋ ಚಾನ್ಸಸ್ ಹೆಚ್ಚು ಅನ್ನೋದು ನಾವು ಪರಿಗಣಿಸ್ತೀವಿ. ಇದಕ್ಕೆ ಟೈಮ್ ಅಪ್ ಅಂಡ್ ಗೋ ಟೆಸ್ಟ್ ಅಂತ ನಾವು ಮಾಡ್ತೀವಿ ನಮ್ಮ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ. ಆಮೇಲೆ ಡ್ಯೂಯಲ್ ಟಾಸ್ಕಿಂಗ್ ಅಂತಾರೆ. ಡ್ಯೂಯಲ್ ಟಾಸ್ಕಿಂಗ್ ಅಂದ್ರೆ ನೀವು ಬೆಳಿಗ್ಗೆ ವಾಕಿಂಗ್ ಹೋಗ್ತಾ ಇರ್ತೀರಿ, ಎಲ್ಲರೂ ವಾಕಿಂಗ್ ಮಾಡ್ತಾ ಇರ್ತೀರಿ. ಮಕ್ಕಳಿಗೆ ಒಬ್ಬ ಸ್ನೇಹಿತ ಬಂದು ನಿಮ್ ಜೊತೆ ಮಾತಾಡ್ತಾನೆ. ಒಂದು ಉದಾಹರಣೆ ಕೊಡ್ತಾ ಇದ್ದೀನಿ. ನಿಮ್ ಸ್ನೇಹಿತ ಮಾತಾಡಿದ ಕೂಡಲೇ ಇಬ್ರು ಮಾತಾಡ್ಕೋತೆ ಮುಂದೆ ಹೋಗ್ತಾರೆ, ಕೆಲವೊಬ್ರು ನಿಂತು ಬಿಡ್ತಾರೆ, ನಿಂತು ಪೂರ್ತಿ ಟರ್ನ್ ಆಗ್ತಾರೆ, ಆಮೇಲೆ ಮಾತಾಡ್ಲಿಕ್ಕೆ ಚಾಲೂ ಮಾಡ್ತಾರೆ. ಸೊ ದಿಸ್ ಈಸ್ ಕಾಲ್ಡ್ ಡ್ಯೂಯಲ್ ಟಾಸ್ಕ್ ಸ್ಟಡೀಸ್ ಆಲ್ಸೋ, ವೇರ್ ದ ಓಲ್ಡ್ ಪರ್ಸನ್ ಈಸ್ ನಾಟ್ ಏಬಲ್ ಟು move and talk at the same time. So he stops, take a turn, and then start talking. So he is also likely to fall. And rikshasana antare, tree pose. ಇದು ಒಂದ್ ಕಾಲ್ ಮೇಲೆ ನಿಂತು ಎಷ್ಟೋ ಜನ ಯೋಗ ಮಾಡ್ತಾ ಇರ್ತೀರಿ. ಯೋಗ ಮಾಡೋರಿಗೆ ರೂಢ ಇರುತ್ತೆ, ಯೋಗ ಮಾಡ್ಲಾರ್ದವ್ರಿಗೆ ಟ್ರೈ ಮಾಡಬೇಡಿ. ಪ್ಲೀಸ್ ಡೋಂಟ್ ಟ್ರೈ. ದೋಸ್ ಹೂ ಆರ್ ನಾಟ್ ಡೂಯಿಂಗ್ ಯೋಗ, ಪ್ಲೀಸ್ ಡೋಂಟ್ ಟ್ರೈ ಇನ್ ದ ಹೋಮ್. ಅಂಡ್ 10 ಸೆಕೆಂಡ್ ಒನ್ ಲೆಗ್ ಸ್ಟೆಲ್ಸ್ ಮಾಡಿ ನಿಂತ್ರಂದ್ರೆ ಯು ಆರ್ ಲೆಸ್ ಲೈಕ್ಲಿ ಟು ಫಾಲ್. ಓಕೆ, ಈ ಪೋಸ್ಟರ್ ಅಲ್ಲಿ ನೀವು 10 ಸೆಕೆಂಡ್ ನಿಂತ್ರೆ, ಬಟ್ ವಾರ್ನಿಂಗ್, ಯಾರು ಇದು ಮನೆಯಲ್ಲಿ ಮಾಡತಕ್ಕದ್ದು ನೀವು ಮಾಡಬೇಡ್ರಿ. ಮಾಡ್ತಾ ಇದ್ರೂ ನೀವು ಮಗ್ಗಲ್ಗೊಬ್ರು ಯಾರು ನಿಮ್ ರಿಲೇಟಿವ್ಸ್ ಕರ್ಕೊಂಡಿಲ್ರಿ, ಅಥವಾ ಒಂದು ಸಪೋರ್ಟ್ ಇಟ್ಕೊಂಡೆ ಮಾಡ್ಬೇಕು. ಮನೆಯಲ್ಲಿ ಹಿಂಗೆ ಟ್ರೈ ಮಾಡ್ಲಿಕ್ಕೆ ಹೋಗಬೇಡಿ, ದಯವಿಟ್ಟು ಮಾಡಬೇಡಿ. ದೆನ್ ಫಂಕ್ಷನಲ್ ರೀಚ್ ಅಂತೀವಿ. ಸೊ ಫಂಕ್ಷನಲ್ ರೀಚ್ ಅಲ್ಲಿ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ, ಒಂದು ಪೇಷಂಟ್ಸ್ಗೆ ಮೊದಲು ಹಿಂಗ್ ನಿಂದ್ರಿಸ್ತೀವಿ, ಆಮೇಲೆ ಇದೊಂದು ಇಂಚ್ಪಟ್ಟಿ ಇರ್ತೀವಿ. ಸೊ ಇವರು ಬರೀ ಹಿಂಗ್ ಕೈ ಅಷ್ಟೇ ಮುಂದೆ ಮಾಡ್ಬೇಕು. ಶಿ ಹ್ಯಾಸ್ ಟು place the rule, and the patient has to bend forward. So how long they can bend forward? So that is reach forward as you can without taking a step. Okay, so this will tell you that are you a risk for fall. ಇವೆಲ್ಲ ಸಿಂಪಲ್ ಟೆಸ್ಟ್ ನಾವು ಮಾಡ್ತೀವಿ. ಆಮೇಲೆ ಎರಡು ಕಾಲ್ ಜೋಡಿಸಿ ನಿಲ್ಬೇಕು. ಎರಡು ಕಾಲು ಜೋಡಿಸಿ ಒಂದಕ್ಕೊಂದೇ ಜೋಡಿಸಿ ಎಷ್ಟೊತ್ತು ನಿಂದಿರಬಹುದು? 10 ಸೆಕೆಂಡ್ಸ್ ನಿಂದಿರ್ತೀರಾ? ಎಸ್, ಮೋರ್ ದನ್ 10 seconds if you able to stand, you are very good. ಒಂದು ಕಾಲ್ ಮುಂದೆ, ಒಂದು ಕಾಲ್ ಹಿಂದು ಅಷ್ಟೇ. ಆಮೇಲೆ ಟೋಟಲ್ ಟ್ಯಾಂಡಮ್ ವಾಕಿಂಗ್ ಅಂತಾರೆ. ಹಿಂಗೆ ಒಂದು ಕಾಲ್ ಮುಂದೆ, ಒಂದು ಕಾಲ್ ಇಡಬೇಕು, ಒಂದು ಫುಟ್ ಮುಂದೆ, ಒಂದೊಂದು ಫುಟ್ ಮಾಡಿ ನಿಲ್ಬೇಕು. 10 ಸೆಕೆಂಡ್ ಕಿಂತ ನೀವು ಹೆಚ್ಚು ನಿಂತ್ರೆ you are less likely to fall. And standing on one foot. Okay, please, I request again, don't try in home alone. Okay, take the help. Go whenever you are going for a checkup. These things are done in physiotherapy department. These things are done in the geriatric department to know whether are you at risk for fall or not. Now another simple, ನಾವು ಏನಾದ್ರೂ ಕೆಳಗೆ ಪೆನ್ ಬಿದ್ದಿರ್ತದೆ, ಚಾಕ್ಲೇಟ್ ಬಿದ್ದಿರ್ತದೆ, ನಾವು ಎತ್ತಬಹುದಾ? ಬೆಗ್ ಎತ್ತಬಹುದಾ? ಸೊ ಬೆಂಡ್ ಡೌನ್ ಅಂಡ್ ರೀಚ್, pick up the object. ನೀವು ವಿದೌಟ್ ಲೂಸಿಂಗ್ ಬ್ಯಾಲೆನ್ಸ್ ನೀವು ಮಾಡಿದ್ರೆ ಯು ಆರ್ ಲೆಸ್ ಲೈಕ್ಲಿ ಟು ಫಾಲ್. ಬಟ್ ನೀವು ಹಿಂಗೆ ಕೆಳಗಿನ ಬಿದ್ದ ಸಾಮಾನ್ಯ ಎತ್ತಲಿಕ್ಕೆ ನಿಮ್ಗೆ ಜೋಲಿ ಹೋಗ್ತಾ ಇದೆ, ಅಥವಾ ಯು ಆರ್ ಲೂಸಿಂಗ್ ಬ್ಯಾಲೆನ್ಸ್ ಅಂದ್ರೆ ಯು ಆರ್ ಲೈಕ್ಲಿ ಟು ಫಾಲ್. ಸೊ ದೆನ್ ಫರ್ದರ್ ಟೆಸ್ಟ್ ವಿ ಡೂ. ಇದು ಒಂದು ಇಂಪಾರ್ಟೆಂಟ್ ಪಿಕ್ಚರ್. ಇದು ಎಲ್ಲರೂ ನೋಡಬೇಕಾಗಿದೆ, ನೀವೆಲ್ಲರೂ ತಿಳ್ಕೊಳ್ಬೇಕಾಗಿದೆ ಪಿಕ್ಚರ್ ಇದೆ ಇದು. ಇದರಲ್ಲಿ ಏನ್ ಬರ್ದಿದ್ದಾರೆ ಅಂದ್ರೆ ಚೆಕ್ ಲಿಸ್ಟ್. ಕಿಚನ್ ಅಲ್ಲಿ, ಬೇಸಿಕಲಿ ಹೆಣ್ಮಕ್ಳು ಕಿಚನ್ ಅಲ್ಲಿ ಏನೆಲ್ಲ ನೋಡ್ಬೇಕಪ್ಪ ಅಂತಂದ್ರೆ, ಇವರು ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಈ ಸ್ಟೂಲ್ ಮ್ಯಾಗ ನಿಂತು ಇಂಥವೆಲ್ಲ ಏರೋದು ಇಳಿದು ಮಾಡಬಾರ್ದು, ಇಂಥವ್ ರಗ್ಗರ್ಸ್ ಇರಬಾರ್ದು, ಕಿಚನ್ ಅಲ್ಲಿ ಪೆಟ್ಸ್ ಬರಿಸ್ಕೊಡ್ಬಾರ್ದು, ಅಡಿಕ್ವೇಟ್ ಸ್ಪೇಸ್ ಇರಬೇಕು, ಇಂಥ ಲೈಟಿಂಗ್ ಒಳ್ಳೇದಿರ್ಬೇಕು. ಹಿಂಗೆಲ್ಲಾ ಚೆಕ್ ಲಿಸ್ಟ್ ಇದೆ ಇದು. ನಾ ಚೆಕ್ ಲಿಸ್ಟ್ ಬೇಕಾದ್ರೆ ಮತ್ತೆ ಜಮುನಾಥ್ ಸರ್ ನಿಮ್ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಹಾಕ್ತೀನಿ. ಈ ಚೆಕ್ ಲಿಸ್ಟ್ ಅಲ್ಲಿ ಯಾವ್ದಾದ್ರು ಒಂದ್ ಕೂಡ ಇದ್ರೂ ದಟ್ ಓಲ್ಡ್ ಲೇಡಿ ಈಸ್ ರಿಸ್ಕ್ ಫಾರ್ ಫಾಲ್. ಎಸ್, ರಿಸ್ಕ್ ಫಾರ್ ಫಾಲ್. ಓಕೆ, ದೆನ್ ಬೀಳಬಾರ್ದು. ಬಿದ್ರಂದ್ರೆ ಏನ್ ಮಾಡ್ಬಹುದು? ಮನೆಯಲ್ಲಿ ನಿಮ್ಗೆ ಕರೀತಾರೆ, ಯಾರಾದ್ರೂ ಒಬ್ರು ಮನೆಯಲ್ಲಿ ನಿಮ್ಮ ನೇಬರ್ ಇರ್ತಾರೆ, ಬೀಳ್ತಾರೆ, ಯಾರು ಏನ್ ಮಾಡ್ಬೇಕು? ಓಕೆ, ಪೇಷಂಟ್ ಅವ್ರು ಬಿದ್ದವರು ಅಲರ್ಟ್ ಇದ್ದಾರೋ ಇಲ್ಲೋ, ಅವ್ರಿಗೇನ್ ತುಂಬಾ ಬೆವರು ಬಿಡ್ತಾ ಇದೆ, ಅದಕ್ಕೆ ಸಕ್ಕರೆ ಹಾಕರಿ ಬಾಯಲ್ಲಿ, ಮೇ ಬಿ ಬಿಕಾಸ್ ಆಫ್ ಲೋ ಗ್ಲೂಕೋಸ್, ಮೇ ಬಿ ಬಿಕಾಸ್ ಆಫ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್, ಅಥವಾ ಅವ್ರಿಗೆ ಝಟ್ಕಾ ಬರ್ತಾ ಇದೆಯೇನೋ, ಅಥವಾ ನಾ ಹೇಳ್ದೆ ಅವ್ರು ಕಾಲು ಉದ್ದಿದ್ದೇನೋ, ಒಂದು ಗಿಡ್ಡಿದೆ ಆಗಿದೆ, ಅಥವಾ ಅವರು ತಲೆಯಲ್ಲಿ ಗಾಯ ಆಗಿದೆ, ರಕ್ತಸ್ರಾವ ಆಗ್ತಾ ಇದೆ. ಸೊ ಇಂತ ಆದಲ್ಲಿ ಪಟ್ನೆ ತುರಂತ ನೀವು ಆಂಬ್ಯುಲೆನ್ಸ್ ಕಾಲ್ ಮಾಡಿ. ಆಮೇಲೆ ಕೀಪ್ ಯುವರ್ ಸೆಲ್ಫ್ ಕಾಮ್ ವೆನ್ ಯು ಆರ್ ಅಟೆಂಡಿಂಗ್ your neighbors or anybody friends. If such a situation, keep yourself calm, don't blame anybody, don't shout anybody, just arrange an ambulance and immediately try to shift them up. ಸಿಂಗಾಪುರ್ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ದೊಡ್ಡ ದೊಡ್ಡ ಬ್ಯಾನರ್ಸ್ ಹಾಕಿದ್ದಾರೆ. ನೀವು ಒಬ್ಬರೇ ಮನೆಯಲ್ಲಿ ಒಬ್ಬರೇ ಇದ್ದೀರಿ, ನೀವು ಬಿದ್ದರೆ ಏನ್ ಮಾಡಬೇಕು? So you just keep moving with the other side of the limb, and you can crawl, catch hold of the help of the chair and sit on the chair, and then call your friends or somebody for or then you can be shifted safely to the hospital in the patient. So ಪ್ರಿವೆನ್ಷನ್ ಆಫ್ ಫಾಲ್ ಎಲ್ಲ ನಾವು ಹೇಗೆ ಮಾಡ್ಬೇಕಪ್ಪ ಅಂತಂದ್ರೆ, ನಾವು ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ, ಓಲ್ಡ್ ಏಜ್ ಪೇಷಂಟ್ ಅಡ್ಮಿಟ್ ಆದಲ್ಲಿ ಇಂತ ಒಂದು ಮ್ಯಾಟ್ರಸ್ ಹಾಕ್ಬಿಡ್ತೀವಿ ಕೆಳಗಡೆ. ಸೊ ಇಟ್ ಇಸ್ ಅ ಬೇಡ್ ಆಫ್ ಸ್ಪಂಜ್. ಇವನ್ ಅವ್ರು ಬಿದ್ರನು, ಯಾಕಂದ್ರೆ ಚೇಂಜ್ ಆಫ್ ಪ್ಲೇಸ್, ದೇ ಆರ್ ಲೈಕ್ಲಿ ಟು ಫಾಲ್. ಸೊ ಬಿದ್ರನು ಕೂಡ ಅವ್ರಿಗೆ ಪೆಟ್ಟು ಬೀಳಬಾರ್ದು, ಅವ್ರಿಗೆ ಗಾಯ ಆಗಬಾರ್ದು. ಆಮೇಲೆ ಮನೆಯಲ್ಲಿ ಇಂಥ ಕಾರ್ಪೆಟ್ಸು ರಗ್ಗರ್ಸು ಇದ್ದಲ್ಲಿ, ಇಂಕ ಕಟ್ ಇದ್ದಲ್ಲಿ ಇಂಥ ತೆಗೆದ್ಬಿಡಬೇಕು ಮನೆಯಲ್ಲಿ. ಡೋಂಟ್ ಕೀಪ್ ಸಚ್ ರಗ್ಗರ್ಸ್ ಆರ್ ಕಾರ್ಪೆಟ್ಸ್ ಇನ್ ದ ಹೋಮ್, ದೇ ಆರ್ ಹೈ ರಿಸ್ಕ್ ಫಾರ್ ಫಾಲ್. These are all safety measures which I am telling you should be taken by all of us. Put the support system behind the toilet, near in the bathrooms, so that whenever the old man gets up, if he feel giddy, at least he has the support to hold. Always build a home and have anti-skid tiles. Anti-skid tiles is very, very important. Even ಮನೆಯಲ್ಲಿ ನನ್ನ ಪೇರೆಂಟ್ಸ್ ಒಳಗೆ ರೂಮ್ ಮಾಡಿದ್ದು anti-skid tiles ಹಾಕಿ ಮಾಡಿದ್ವಿ. ಇಂಥ ಸಪೋರ್ಟ್ಸ್ ಬಾತ್ರೂಮ್ ಅಲ್ಲಿ, ಬೇಸಿನ್ ಮಗ್ಗಲ್ಕು ಅಥವಾ ಟಾಯ್ಲೆಟ್ ಅಲ್ಲಿ ಎಲ್ಲಾದ್ರೂ ಇಂಥ ರೇಲ್ಸ್ ಹಾಕಿಸ್ಬಿಡಿ. ಅಂದ್ರೆ whenever you feel that you are feeling giddy, you can hold. Be caution, these floors are very dangerous. ನೀರ್ ಬಿದ್ದಿದ್ದು ಕಾಣೋದಿಲ್ಲ. Even if the water has spilled, you don't see that there is a spillage. And bed rails, it should be only 1/3 of the cot, not the full. This is there to help them to get up and not to prevent fall. Okay, ಈಗ anti slip footwears ಅಂತ ಬರ್ತಾ ಇದೆ, ಇಂಥ ಸಾಕ್ಸ್ ಬರ್ತಾ ಇದೆ ಈಗ. ಸೊ ಇವನ್ ಇನ್ ದ ನೈಟ್, ಥಂಡಿ ದಿವಸಲ್ಲಿ, if you are habit of going to toilet and you don't want to skid in the bathroom, you can use such socks where it can be used as anti skid. ಹಿಪ್ ಪ್ರೊಟೆಕ್ಟರ್ಸ್ ಅಂತ ಬರ್ತಾ ಇದೆ. ಹಿಪ್ ಪ್ರೊಟೆಕ್ಟರ್ಸ್ ಅಂದ್ರೆ ಏನಪ್ಪಾ ಅಂದ್ರೆ, ಇದು ನಾವು ಚಡ್ಡಿಯಲ್ಲಿ ಹಾಕೋಬಹುದು ಸೈಡಿಗೆ. ಆಮೇಲೆ ಏನಾದ್ರೂ ಎಲ್ಲರೂ ಬಿದ್ರೆ, ಇಟ್ ವಿಲ್ ಪ್ರೊಟೆಕ್ಟ್ ಯುವರ್ ಬೋನ್ getting fractured. So they are called hip protectors. They are also available in the market. Always ensure that the light is in the bathroom. Your bathroom is on every night. Okay, and there are rubber mats in the bathroom, so that this will prevent fall. Okay, in older people when they are coming from bathroom and attending the restroom. Do not stand for the long time, as I have been telling. Chappals loose agidre ಅಥವಾ ಹರಕಿದ್ರೆ ಹಾಪಬೇಡಿ. When you are advised for a bifocal lens and you are likely to fall, these are the chances that you are high chances that you are likely to fall when you are using bifocal lens. ಹಿರಿಯರು ಯಾವಾಗ ಬೀಳ್ತಾರೆ ಅಂದ್ರೆ, ಸ್ಟೆಪ್ಸ್ ಇಂದ ಇಳಿಯುವಾಗೆ ಬೀಳ್ತಾರೆ ಹೆಚ್ಚು, when they are climbing down, not when climbing up. So when they are coming down, they are more likely to fall. And in our side, this dhoti is one of the risk factors, like lungi, for the falls. Never use like this steps to keep some things above the cupboard or above in the cupboard. Don't place like that. Whatever is at your height level, only you keep it. Don't take your pets for morning walk. This is very dangerous. This can lead to fall. Don't take your pets for morning walk with you. So you walk independently and you less likely you are fall. And if you have got stairs in your home, always put it this is what I did in my home. So we have put the colors whenever they have to get down. So this will tell us that the person, that there has to be colored, and there should be handrails which should be colored, and no flower pots, no clutter should be kept in the stairs. And in most of the hospitals, people tie to the hospital beds. That should not be done. Okay, and those who are having low vision should undergo cataract surgery for immediately. Don't delay again for the cataract surgery. Then this is a common problem that we come across in the older person. Every night they have got the uncontrolled diabetes, drinking more water in the night, urge to pass urine, and they had to literally run to the urine. So they may fall while doing this 3-4 times in the night. They may fall. So what we advise them, put a wide mouth bucket next to the bed, old bucket in the home. Night ಇದರಲ್ಲಿ ಪಿ ಮಾಡಿ ಇದರಲ್ಲಿ ಉಚ್ಚಿ ಮಾಡ್ಕೊಂಡು ನೈಟ್ ಎಲ್ಲ ಬೆಳಿಗ್ಗೆ ಎದ್ದ ಕೂಡಲೇ ತೊಳೆದು ಮತ್ತೆ ಸ್ವಚ್ಛ ಮಾಡಿ ಇಡೋದು. ಡೇ ಟೈಮ್ there is no problem. In the night hours, when you have to get up, most of the times you are in sleep mood and you will end up in falls. So always try to keep a bucket next to your bed in the room and pee there and go back to bed. This is a small video. This is not for the poor people who are weak heart. Just see, I was telling you, don't climb on the stools. ನೋಡಿ ಇವರು ಸ್ಟೂಲ್ ಮೇಲೆ ಏರ್ತಾ ಇದ್ದಾರೆ. ಓಕೆ, ಇವ್ರು ಏನ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಸ್ಟೂಲ್ ಅಲ್ಲಿ ಎದ್ದು this is what he is trying to do. So I told you, don't use such tools for your activities. So what will happen? Say there were chances that they will fall. Okay, this is very dangerous fall. Now this lady who had climbed upon the stool, okay, I told you, never keep anything on the stool. Like, see, this lady had climbed on the stool and she wanted to take out some stuff from the cupboard, and now she is putting, and see, this such thing should never happen. So always try to avoid climbing all those things. So there are walking aids available. ನಿಮಗೆ ಯಾವಾಗಾದ್ರೂ ಅನಿಸ್ತು ಈಗ ಯಾಕೆ ನನಗೆ ಬ್ಯಾಲೆನ್ಸ್ ತಪ್ತಾ ಇದೆ, ನನಗೆ ಚಕ್ರ ಬರ್ತಾ ಇದೆ ಅಂದ್ರೆ, always go for a cane. And when you use the cane, always check your wrist height. The crane top should be at your wrist level. When you stand straight, the correct height should be at this level, and then only you use the crane. I have seen many people who are bending and walking with the walkers. So this lady whom we advised to use the stick, her son brought one stick which was around 200 rupees. Then she was not using. After 1 week, I noticed that she is not using this stick. Then I asked him to bring some newer type of stuff. Now he brought another stick which was costing 400 rupees, which was very model one, and like very costly one. It looks very rich look. Still she was not at all using. Then after 15 days, I asked her, why you don't want to use stick? What is your problem? She said, see, I want something called fashionable stick. I don't want such sticks. Okay, you have to look at the lady's point of view. She said, I want foldable sticks, color, and like a female, I can take it with a pride. So when I feel giddy, I use it. When I don't want, I can put it in the bag. So you have to always look at the futures, perspectives from the woman. Now, this is very important aspect. You have to sit down while wearing shoes, while having bath, while wearing clothes after having bath. And when you are traveling, don't go and stand near the exit doors. Sit in the last seat that is available. Don't wait. Don't stand and wear clothes. Don't stand and have bath. Always sit and have bath. Always sit and wear the clothes. This will prevent a fall. Okay, that is very, very important. And what else can prevent? Walking and stretching. Yes. Tai Chi exercise. These are the best exercise that one can have that can prevent falls. That has been scientifically proved across the world. Simple Tai Chi exercise can prevent falls. Yoga, yes. Strength and balance exercise, yes. ನಾನು ಬರೀ ಯೋಗ ಮಾಡ್ತೀನಿ, ಇದೆಲ್ಲ ಮಾಡೋದಿಲ್ಲ ಸರ್ ಅಂದ್ರೆ ಆಗೋದಿಲ್ಲ. Because falls is because of multiple diseases, multiple things. So you need all exercises, or not only yoga, you also need muscle strengthening exercise, you need balance exercise, you need walking, stretching. So all you need it to be done over a period. ನಾನು 2 ಗಂಟೆ ಯೋಗ ಮಾಡ್ತೀನಿ, no, that is okay, you do it, but also you add strengthening exercise, muscle strength exercise, muscle balance exercise kuda ನೀವು ಮಾಡ್ತಾ ಇರಬೇಕು. So that will prevent fall. Merely doing yoga or only doing walking will not prevent. You have to have a balance of all the types of exercises in a day to prevent falls and to build a muscle strength. That is very, very important. ಈಗ ತುಂಬಾ ಡಿಜಿಟಲ್ ಟೆಕ್ನಾಲಜಿ ಬರ್ತಾ ಇದೆ. How to identify this will only help to identify when you had a fall. Okay, so most of the time these all sensors create a siren when you fall. Okay, most of the time they are not found. This is the one which you can place in your room, and it doesn't have a camera, but it will sense that you had a fall and it gives an alarm to your children's mobile. Sensors, ಕೊಳ್ಳಲ್ ಹಾಕೊಳ್ಳೋದು, you just wear in the neck. Whenever you fall, you press this button, it gives an alarm to your near dear ones that you had a fall. But most of the times when a person falls, he himself is under so much aggression or stress, he will forget that there is something called why to press the button and all those things. There is also an app to prevent falls that is called Nimble, and if you can download it, but at your own risk. I will not suggest any apps because nowadays a lot of cyber crime is happening. So it is but simple and easy to use. It will tell you how many exercise you have done, how many stand-ups you have to do, and it will also tell you the better mental exercise also. So this nimble training for balance is being recommended in many countries. You can also try. Now, the newer technologies, as Dr. Hemadri is there, he was telling me about this, that if you have protectors, that the new balance tappadalli, idu car alli hange balloons develop agutte, blow agutte, hage idu kuda balloons blow agutte ನಿಮ್ಮ ಬಾಡಿಯಲ್ಲಿ sensor ನೋಡಿ ಅದು, so that it can prevent fractures. And there is a watch. So you wear the watch, and whenever you fall, then it detects and gives an alarm to the family members. There are also called something called bed sensors. You bed ಮೇಲೆ ಹಾಕಿ ಮಲಗಿಬಿಡುದು. Whenever you try to get up, so the next your family members will get a beep that he has got up from the bed, he has got up from the bed. So immediately you can go and attend to him. So there are so many things are available now, but what is important is prevention. So this gentleman is selling the stick. This stick has a it has got an adjustable height, and it has got a light, and it has got a siren that if you have an emergency, you can press the button. It has also got an FM. In your garden, you can listen to the songs. Now, such sticks have modified with four types of wheels that they can have for the good support. Now, what is required everywhere now? Government of India, Government of Karnataka is telling is to have an senior friendly facilities in all the government setups and even in private setup. This is what we are already done long back in our hospital. This is a ramp that they come. The rails are there everywhere in my hospital. The bedside shot is very short so that they can come and sit immediately. There are rails everywhere to go to the toilet and come and move on the corridor. Even we have a special wheelchairs where they can sit, recline, the recliner chairs, and there is also a facility for to have a toilet sitting on the wheelchair itself. So all these things are there for older people to prevent a fall. Now, just to inform you that there are two books, very important books that are available on WHO website, and this is from the Singapore Institute of Geriatrics and Active-Aging. This is very important books. Everybody can download this and step safely from childhood to older. So WHO has given all the measures how to prevent a fall in all age groups. And this book by Institute of Geriatrics and Active-Aging is another important book. He has informed all the important measures to prevent a fall. So I just like to conclude with telling that not all older people fall, but don't ignore mild symptoms. If you had fall once or twice, please go to a doctor and consult yourself so that you should not fall again. And remember, falls are very costly, and falls leads to poor quality of life. So what is the best predictor? As Jambunathan sir was asking, what is the best blood test that predicts fall? The best predictor for a fall is if you had a fall in the past, you are likely to fall again. That is one of the best predictor of the fall in older people. And even if you had a fall and you are not sustained injuries, don't ignore saying that I am good now, I am going to fall. No, don't blame it on the age. Fall has to be identified, fall has to be treated, fall has to be prevented. So it is said that boy falls to standing, young falls to low, and elderly falls to fracture. So this is how we fall in various age groups, and we don't want this. The good patient, we tell him, the patient here is a good one. He tells to the doctor that I had a fall. This lady, no, I will not tell the doctor that I had a fall. I will hide it because I lose my independence. That is not the good thing. You have to always inform your doctor that you had a fall so that preventive measures can be taken. Thank you very much for your patience hearing. We'll open for questions and answers.
Yes, thank you, doctor. It was very interesting, very encouraging. We were encouraged for one thing that, okay, falls are not very common. See, and the other factor is that the frightening factor is that falls are very costly. Therefore, we need to avoid falls at any cost. And You have very beautifully explained at the later part of the presentation how to prevent a fall. I think almost all the points regarding falls has been beautifully covered in about 30-40 minutes, Doctor. Thank you once again. And I have seen some questions in the chat box. See, one thing. See, how to how to improve muscle strength. I think you have told us that there are certain exercises for improving the muscle strength. Isn't it that, Doctor? Is there any other thing that will improve your muscle strength?
Eating all types of food, foods.
Video also, Doctor.
Yes, sir. Sir, eating all variety of foods, especially food rich in proteins. So even if you are a vegetarian, you can eat dal products more, that gives the proteins to your muscles. And everything diet should be balanced, and don't try to lose weight that lead to loss of muscle strength, that was highlighting. And the exercise that are resistance exercise, just holding one water bottle in the hand and flexing for 10 times in the morning and 10 times in the night will improve the muscle strength of the arms. The same thing if you do a sit-ups, sit-ups at least 10 times in the morning, 10 times in the night, that improves the muscle strength in the lower limb. So that simple exercises, depending upon the problems that you are having. Now, most of the people say that, sir, I got knee joint pain. How can I do exercise? No, they are not the excuses, but at least there are some other exercises that you should do. Sitting on the wheelchair also, there are a lot of exercises that you can do just to improve the muscle strength. So food and all types of exercise, it may be walking, maybe it yoga, maybe it resistant exercises, all types of exercise will help, not only one exercise. You may say that I am doing walking around 10 kilometers every day. It is not going to help only for muscles, because we need, as I told you, fall is not single entity, it has multiple entities. So for the answer for your question is well balanced food and all types of exercise in a day, whichever best you can do.
Yes, thank you, Doctor. And I'm amazed at the gratitude that you have received from Madam Shikala Bhatt. See, my sincere gratitude to Dr. Anand Ambali, sir, one of the rare geriatrics experts with a wide vision on the lives of elderly patients, for his exemplary presentation on falls in the elderly. His profound expertise and invaluable insights are truly commendable. I also extend my thanks to the host, Vayomanasa Sanjeevani, for organizing such an impactful session. Thank you, sir. Thank you. And there's one more thing from Nagar. Desi, excellent deliberation. Doctor and the retired medical officer, Bangalore. See, then one more, the Tangaraj has also written a very good presentation. Bed rail is important to prevent falls. And the next one is from Mr. Tachegowda, extremely explained with complete details. So, heartfelt thanks to Dr. Anand on a wonderful presentation is from Ram Shankar to you, Doctor. And see, then Mustafa Ali has also very well explained, Doctor. Thank you. And again, next one is from Arul Selvam. My hearty congratulations. Gave a wonderful session with clear explanation. So, Doctor, a person walking backward is good. And one second. See, this is I'm just reading it from the chat box.
Yes, sir. There are two questions which we have missed.
Yeah.
We will go a little up. Blood it is asked by Sir Bachegowda, sir. Blood tablets to be taken daily or alternatively or in winter season, etc. That's a very important question. And blood thinner tablets has to be taken daily. There is no excuse. So it has to be taken daily. But if you are 70 plus or 65 plus and risk for fall, you can go and consult your doctor or physician. They can change the milder form of blood thinners, so that for the older people they require. So the answer for this is it has to be taken daily. And one more question is there, that if I pour hot water on the head, will I develop fall? See, again, that is a case to case scenario. So some people are habit of having a cold water bath every day, even in the winter season. So they will not develop fall. So some are habits. So it depends upon if you have got any pre-medications or any diseases that is likely to develop following pouring water on your head. So as such, pouring hot water on the head or cold water on the head, less likely to produce falls unless you have some pre-existing diseases. These are the two questions, sir. Now you can go ahead.
Thanks, doctor. Next is then Ram Shankar. After Ram Shankar, that is, Mustafa also I have said. Then Arun Selvam also I have read. The next one is from Shivakumar. Shivakumar, doctor, a person walking backward is good. If so, what precaution not to fall back? Mr. Shivakumar.
Yes, sir. That is a very good question. Person walking is good. If so, what precautions not to fall back? Walking back should be done. I'm telling you, all these things should be done in the presence of another trainer. You should not be just tried whenever you go for a walk, and that is the when you're likely to fall. But walking front, walking good. This is also a good exercise. Even when you're climbing steps, we tell the older persons to climb the step in the reverse way, climb down in the reverse way as well. So that is also one of the part of exercise for osteoarthritis. So going back, walking back, but slowly. But if you are losing balance doing that, please don't attempt that.
So that explains, doctor. Then next is, Kartikeyan. She says beautifully said in a simple language. Thank you so much, sir. I request you to share the recordings, please. So recordings, with regard to recordings, please note this entire recording will be uploaded by tomorrow in our YouTube website. Vayomanasa Sanjeevani website, you can go. It will be there by tomorrow morning or maximum by tomorrow evening. Then next one is from Mr. Vasudevan. He's a very senior citizen, sir, doctor. Excellent presentation, doctor. Thank you very much. Then next question, our Mr. Nagaraj Rao sir has asked this question. Sudden flow of hot water on the head, that is okay. That is, you have answered. The bathroom also could cause a fall. Is it okay? Wonderful explanation. Is it from Shobhan Bhuvana? Then next one is Jayashri. Thank you, sir, for your wonderful explanation. Then Alpha is also a wonderful session, Dr. Anand. Thank you. Thanks so much. Then again, Ganesh says excellent presentation. Then, thank you for all this nice session. Thank you. Very good. All have only thanked you, doctor. See, all our next things are only beautiful, explanation. Beautifully they have thanked you. Very, thank you. Therefore, there thanks I just wanted to convert into, wish also. I think as a gift to you in the form of a wish that on behalf of all of them and on my personal behalf also, I pray God to shower on Dr. Anand and his family all the best in his life. So that, see, it has got, this wish has also got something personal in that, so that he continues his beautiful service to the society. He has been doing an excellent service. In fact, I have been attending his sessions, number of sessions. And every session he is able to bring in something new. I don't know how. So in that context, I really thank you, doctor. We are only looking forward to the next session on some other matter, doctor. Thank you very much.
Sure, sir. Thank you so much. Thanks for your blessings. This is what I've been seeking for last 15 years from the senior team. The blessings works. Thank you so much. Thank you.
Thank you. If, can we close down, doctor?
Yes, sir. We can close down. Thank you.
Because I need your permission to do that. Well, 1 second. I'll close down. I'll close down.
Thank you.
Thank you. Thank you. Thank you. It's a wonderful session once more. Yeah.